So yesterday we ended here sa substitution on the benzene ring. So, di ba, remember, nag-start na tano, we are talking about adrenergic agonist. Do not forget, a little review only, that the major neurotransmitter for this system is the norepinephrine. Though during stress, norepinephrine can be converted to epinephrine, which is also called adrenaline. Now, the parent compound for all our sympathomimetics is the phenylethylamine. So yesterday, we discussed that when you say phenylethylamine, it is composed of a benzene ring, a terminal amino group, meaning nasa last siya, and then we have the alpha or beta carbons sa amino chain. So, what else did we discuss yesterday? So we discussed also how norepinephrine is produced sa atoang adrenergic neuron. So please do review that one para masulod jud siya sa atoang sa atoang memory katong process and how to produce the norepinephrine. So anyway, so we have started with the substitutions and the different parts of the phenylethylamine. And then we discussed that on the benzene ring, we can substitute 2 hydrogens at carbons 3 and 4 to make it a catechol. So, pag may dalawang OH na yan siya at positions 3 and 4, mahimo na siyang catechol plus the amino group, the amino chain, mahimo siya og catechol amine. Now, the presence of that OH, dalawang OH there, will make it susceptible to the degradation of the COMT or the catechol O-methyl transferase. That is why you cannot see a catecholamine that is given via the oral route. So anong ginawa? We have a lot of drugs, though they are sympathomimetics also, but they can be given orally. And the reason of that is either tinanggal ang isang OH or dalawang OH, meaning hindi na sila pwedeng tawagin na catechol or catechol amine. So one example of that is our nasal decongestant called phenylephrine, in which though its structure is patterned to epinephrine but kulang siya ng OH, therefore it can be active orally. Okay? And the same thing with ephedrine, amphetamine, and methamphetamine. So if you look at their structures, for phenylephrine kulang ng OH, but for ephedrine, amphetamine, and methamphetamine, wala na talaga yung dalawang OH, meaning they are not catechol already. Silang lahat, pwede na sila i-consume or i-administer orally. Questions before ta mag-move on, ane? Wala. Wait lang, ha. I-ano lang ako ang electric fan. Sakit kaya siya sa mata. Okay, so you have no questions. Let's continue. Let's move on sa substitutions on the amino group. Okay? Amino group na tayo. So when you say amino group, it's the NH, the terminal na amine group. So take note of the following changes in the activity if merong substitution. So increasing the length of the alkyl substituents on the amino group tends to increase beta receptor activity. That's activity class. Just get the extra I. Again, increasing the length of the alkyl substituents on the amino group tends to increase beta receptor activity. So take note of this structure. We have the NH here. And then, kung titingnan ninyo, merong substituent sa NH. Di ba supposedly this is NH2. So we remove the hydrogen and then we replace it with a substituent. So in this case, this is isopropyl. This one is a bulkier na substituent, which makes this drug favor binding to beta receptor than the alpha receptor. So actually, this structure is the structure of the isoproterenol. So na-encounter nato si isoproterenol. Let me go back. Kadyot lang. In this one sa selector, selectivity. So, di ba, ato siyang gi-appeal sa pag-compare with norepinephrine and epinephrine when it comes to binding sa beta receptor. So, ang pinaka nag-bond sa beta receptor is si isoproterenol. And if asked nga no, na ano man siya, though this one is also a catechol amine ha. Catechol amine gihapon ang iyahang structure. Pero since 'di ba endogenous si epi ug si norepi, ginahimo siya inside our body. Si isoproterenol is not endogenous, but when you administer this, mas gina-favor niya ang iyahang affinity is more on the beta receptor than on the alpha receptor. And then the reason of that is the presence of substituent on the on the amino group. So balikan nato. So again, this is still a catechol amine. So take note, nagihapon siya duha ka OH, and then you have the NH here with the substituent again. Okay? And then methyl substitution on the norepinephrine yielding epinephrine enhances activity at the beta-2 receptor. So this time naman, comparison between the norepi and the epinephrine. So I hope you have a copy of the structures yesterday. I drew the structures yesterday at the screen. On the screen. So please look at the structures of epi and norepi. Diba the difference nila is on the amino group. So sa amino group, si epinephrine na ay methyl substitution, meaning na siya ay CH3. So that makes it, that is the reason why mas taas pud ang affinity ni epi sa beta receptor kaysa sa norepinephrine. So si isoproterenol na mention na nako kagaina, mas taas jud ang iyahang affinity to beta receptor compared to epinephrine kay mas dako ang iyahang substitution. It's an isopropyl compared to the methyl group of the epinephrine. So again ha, if you are asked what is the effect if may substitution sa amino group, ang effect ana is the drug will favor binding to beta receptor than the alpha receptor. So mag-lower ang iyahang activity on the alpha receptor. So just like isoproterenol, it's very active on the beta receptor but it has a very weak activity sa alpha. So I'm talking about alpha and beta as a whole ha. Alpha 1, alpha 2, beta 1, 2, and 3. Okay? Questions, class, about the substitutions on the amino group? Wala. Tingog mo ha, basig na sige kog yaw-yaw diri tapos waday ko'y ka-istorya. Yeah, dili ra balalim ni akong wagi na pang storya diri. Sige, let's move on. Substitutions at the alpha carbon. So yesterday, I have also introduced to you what is an alpha carbon. So let's go back. Let's take isoproterenol as an example na lang. If this is the amino group, this is the terminal amino group. Ang sunod niya nga carbon is called the alpha carbon. So this carbon here is the alpha carbon and the next carbon is called the beta carbon. So what will happen to a drug if it has a substitution at the alpha carbon? So any substitution, it can be a methyl, an ethyl, an isopropyl, basta naa siya substitution on the alpha group, it will cause na mablock ang oxidation by MAO. So this time naman, para dili siya ma-recognize ni MAO and dili siya ma-degrade, dili siya ma-destroy, dili siya ma-metabolize sa enzyme na monoamine oxidase, butangan nato siya og substituent on the alpha carbon. So aside from that, since dili siya recognize ni MAO, it can prolong the action of the drugs, mga non-catecholamines. It can prolong the action of the drug. So examples of drugs na mayroong substitution at the alpha carbon are the ephedrine and amphetamine. So kani silang duha, ephedrine and amphetamine, diba? Wala sila'y OH, so they are not catecholamines. Dili sila ma-recognize sa COMT, so pwede sila ihatag orally, and at the same time, dili pud sila basta-basta ma-oxidize by the MAO, kay naa sila'y substituent on the alpha carbon. So ini atong example diri, ephedrine and amphetamine. So let's see. So ephedrine here, take note of this. This is the N here. This is the terminal amino group. Therefore, ang kasunod niya na carbon is the alpha carbon. So as you can see, ephedrine has a substitution here, and that is the methyl. And actually, it's the same thing with amphetamine. So naapod na siya CH3 on the alpha carbon. Pero actually, si methamphetamine pod, naapod na siya substitution on the alpha carbon. That is why they have prolonged duration of action, meaning they can stay in the body for a long period of time. And this is also the reason why they can reach the brain, they can reach the central nervous system, and kani sila na mga drugs naa sila'y mga effects sa CNS. So they are these two are prohibited drugs, and ephedrine is a regulated drug. So you cannot buy this without prescription. And to be exact, it has to be a yellow prescription para makapalit mo ani. Especially the amphetamine, kani kay ano gini siya, prohibited drug. Okay? Questions about the substitution sa alpha carbon? Wala. So how about the substitutions at the beta carbon? Most of our direct acting agonists typically have a beta hydroxyl group, meaning on the beta carbon, most of our drugs for na sympathomimetic and direct acting, na-adjud na sila yung OH dito. But actually, it has nothing to do with their activity. So, except for dopamine, si dopamine lang ang walay OH. Okay? So, as you can see, balik ta ha kasi nasa previous na mga slides ang ato ang mga drugs. So, like isoproterenol. So, this one is the beta carbon here. Na-add siya yung OH, as well as ephedrine. Though amphetamine and methamphetamine don't have OH. Phenylephrine also have OH sa iyahang beta carbon. And if we go back really to this one, the norepi, sorry, this is the epinephrine. naa siya OH as well as the norepinephrine. Ang nalahi sa ilaha is ang dopamine. So si dopamine wala siya OH na substitution sa beta carbon. But it has nothing to do with the activity ha. So naalang dyan na siya din ha, the presence of OH. So dili siya parehas sa substitution on the benzene, on the amino and the alpha carbon nga naay effect on the activity of the drug. Kaning sa beta carbon wala siya effect. Okay? Questions? Wala. Sure, nagyud na. Nagkasinabot pa ta dinhing dapita sa atong pharmacology. Kasi mag-information overload na punta ha. By the way, mag-quiz ta ani sa Monday. Sure na nga mag-quiz ko, but dili ko sure kung na ako. ana lang na siya, sure ko nga mag-quiz ko pero dili ko sure kung na ako. So basig na ay mag-sub sa ako sa Monday. So anyway, I'll just update you kung naaba ko or wala. Basta mag-quiz ko, so kailangan ninyo mag-study. Okay? Wala na questions kayo magsugod na gyud ta sa activity ni yun sa ni ha biyahe. Mag-leave lang ko. Mag-leave ko. Sayang akong leave kung dili na ko siya gamiton. Okay? And mapanos na siya, okay? Dili siya. Pag mulipas naman good ang March, di na ako siya pwede gamiton. So I need to use that. Gusto na ko siya gamiton. Ano lang, gusto na ko siya gamiton either sa Monday next week or sa Friday karon nga week. So either mag-leave sad mo. Ang maestra lang ang nailib, naami kanang what do you call that leave? Basta naami leave. So mag-leave ko either sa Friday karon nga week. So basig wala tay farm camp tuwa na. Pero wala pa man ko ka-decide kung kano sa jud ko mag-leave. So maybe tomorrow I can decide. Basta mag-leave jud ko. Wala biya ko nag-absent, di ba? Kanus ako niyo makita ni absent nagklase. Wala ko na siya ginagamit akong leave sukad-sukad. So, karon naisipan ako mag-leave. Happy mo, oy, pero mag-quiz gyapon ko. Okay? Kamusta? Wala mo nag-absent? Sana all. Wala nag-absent. Sige, let's talk about the organ system effects of sympathomimetic drugs. So this is true from the endogenous neurotransmitters norepi and epinephrine. It will be also true for dopamine actually, but let's have a separate discussion for dopamine. And then this is true for all the sympathomimetic drugs. Okay? Let's start with the alpha-1 receptor. Di ba 5 kabuk ato ang receptor na so mag-start sa alpha-1. Isa-isa ho na to tanan effect ni alpha-1. Agonist man ni. So pag ang agonist mo bind kay alpha-1 receptor, ma-stimulate siya. Pag ma-stimulate siya, ma-activate siya, mauni ang mga effects. So ang major location kung asa pinakadaghan makita si alpha-1 is actually on the mostly sa mga vascular smooth muscles. And I'm talking about the blood vessels. Vascular smooth muscles, it's the blood vessels. So, ang mga alpha-1 receptor sa blood vessel, pag na-activate na sila class, mag-contract na sila. So if this is the blood vessel, pag contract ana nila, ang meaning ana mo constrict. Kay ang muscles man ni contract, so ang what you call that, opening kung asa mag-flow ang blood, mugamay. So there will be vasoconstriction. So do not forget class na if there is vasoconstriction, ang effect ana niya sa blood pressure is mutaas kasi there is resistance. mugamay ang agianan sa blood. So pag mugamay ang agianan sa blood, what will happen? It needs a lot of force, a lot of pressure para i-push ang blood mo nga mo flow siya. So that's the number one, and that's the major activity of the alpha 1 receptor. So aside from that, mga ano na lang ni siya, mga minor effects, though effect gihapon. So ang alpha 1 pod, it can cause dilation of the pupil. So makita po siya sa pupillary dilator muscle, and pag ma-activate, mag-contract na siya, and ang ending mag-dilate ang pupil. And then, alpha-1 receptors can also be found sa atuang pilomotor smooth muscle at the ending of our hair. So, ang uban nga alpha-1 nga agonist class, pag na-activate nila ang ang receptor, usahay makakita mo sa libro side effect. Erection of the hair. So, kung sa layman's term pa, it's called goosebumps. So, usahay mag-goosebumps. Ate kayo no nga, kanang, for example, pasangin dayon ang mga naay ni Age, pero actually, it's because of a drug. It can be a side effect of the drug because the receptor can be found sa atuang pilomotor smooth muscle. So, example, ana alpha-1. So, there will be erection of the hair. So goosebumps in layman's term. And then for males class, alpha-1 can also be found sa ilahang prostate. And once activated, it can cause contraction of the prostate. So as we discuss drugs, especially not really with the agonist kasi we don't want na mag-contract ang ilahang prostate, no? It's more on the antagonist sa next chapter. Now we will discuss the effect of alpha-1 inhibition sa sakit sa mga lalaki sa ilahang prostate. Okay? Now for the heart, though this is just minimal, dili jud siya ing ato kadaghan, but nevertheless naagihapoy alpha-1 receptor sa heart. It can cause increase in the force of contraction. So wait lang ha, unti ko kadjut lang. Okay? Continue tayo. So, I ended with the heart, no? So, mag-increase ang force of contraction. Medical term for that is inotropy. Okay? When I talk about inotropy, pag ma-mention ganin ako ng inotropy, I'm referring to the force of contraction. So, if nag-increase ang force of contraction, we call it positive inotropy. Kasi may mga drugs din na mag-cause na mag-decrease ang force of contraction sa heart. So, ang tawag nato ana kay negative inotropy. So, please remember this terms. Okay? Sige, delete na nako na. Okay? Next, ay na-mention na ng blood vessels na naulit lang na siya. So, mag-cause siya og vasoconstriction. So, mag-increase ang BP. And then, for the eyes, it will cause mydriasis na mention pa na po ni Kagain na mag-dilate og pupil. And then, on the last one, sa urinary bladder na to, we also have alpha-1 receptors there, and in which na kapag ma-activate na sila, it will increase closure of the internal sphincter. When you say internal sphincter, it's the opening of the bladder. So if you activate the alpha-1, it means mag-close ang sphincter. And it will result na dili ka makaihi. So mauna siya ang reason class why ingon ko sa fight or flight during time na na-stress ka, you are in the middle of stress, dili ka actually makahuna-huna. Hindi ka makafeel nga kaihion ka. Kasi you have too much norepinephrine or epinephrine by that time, and then syempre it can bind to alpha-1 receptors. Therefore, appeal na din ang pag-close sa ato ang sphincter. So there will be no urination. So you will observe urination dito sa rest and digest na system, which is the parasympathetic katong sa kay acetylcholine. Okay? So next we have the alpha 2. So we are done with the alpha 2. Now for the alpha 1. So we are now sa alpha 2. It can be located sa mga platelets nato, in which na kapag na-stimulate ang mga alpha 2 receptors sa platelets, it can trigger aggregation. When you say aggregation, magkumpul-kumpul na sila, stick sila together forming a clot. And this one is the major location of our alpha-2 receptor. Diba, ingon ko, this one is an exception among the 5 because it's a presynaptically located siya na receptor. So dito siya before siya sa synapse. So makita siya sa either adrenergic and cholinergic nerve terminal. So nakadikit siya dito sa nerve sa last. So presynapse. So kapag ma-activate nimo na si alpha 2, ang iyahan noong effect is ma-inhibit na hinuon ang transmitter release. So pag na-activate si alpha 2, wala na kay ma-release pa na mga norepinephrine. Wala na ma-release kay iyahan na siyang i-inhibit once si alpha 2 ma-activate. And then there are some vascular smooth muscles or blood vessels na ay alpha 2, but this one is in minimal amount only, and it can also cause contraction. So pwede po siya mag-cause of vasoconstriction. Pero again, this is very minimal. And alpha 2 receptors can also be found sa fat cells, in which kapag sa atong mga fats, pag ma-activate na siya, this will inhibit lipolysis. So pag mayroon kag lipolysis, that's breakdown of our fats. So kay inhibition man na, dili mag-breakdown ng ato ang fats if alpha-2 receptor is being activated. Sa mga receptors class, mga receptors nato sa adrenergic system, ang dapat ninyong tandaan katong basta moingon na gani ko og major location of these receptors, kailangan jud na ninyo siya tandaan. Kasi kung mao na iyahang major receptor, mao pud na ang iyahang major activity sa body. Next, we have the beta-1 receptor. So wala na kay laing makita kung, I mean, ang major location na gid na niya sa heart. Dito gid na siya concentrated, pinakadaghan si beta receptors. Though we can also see beta-1 receptors at the juxtaglomerular cells sa kidneys. So it's it's specific to the juxtaglomerular cells sa kidneys. So what will be the effect of stimulating the beta-1 receptor? It will cause increase in the force and rate of contraction of the heart. So na-mention na nako ang force kagaina, it's inotropy. Now, how about the rate of contraction? Pag maingon kag rate of contraction, we call it, sorry, kulang R. It's chronotropy. So again, if you hear the word chronotropy, it refers to the rate of contraction of the heart. So naapod ta pag mag-increase ang imuhang rate of contraction, then that's positive chronotropy. If magbaba, it's negative chronotropy. And for the kidneys, since you can also see beta-1 receptor sa juxtaglomerular cells sa kidneys, ang effect na pudaan na niya is the increase in the release of renin. So, sa mga sunod na mga chapters, we will be discussing what is renin. Again, it's a substance produced by the kidney, and it has something to do with the regulation of our blood pressure. So, dito na siya involved sa RAAS, renin, angiotensin, aldosterone system. So I believe you are familiar with the angiotensin, what do you call that? Dito na siya sa mga anti-hypertensive drugs. So si renin has something to do with the blood pressure. And then, the next one is the beta-2 receptor. So major location of our beta-2 receptor is sa bronchioles and sa lungs. Again, sa bronchioles and sa lungs. So this is more on the respiratory system, though you can also see beta-2 receptors sa uterine and some other vascular smooth muscle. But nevertheless, ang effect niya sa mga muscles na they are smooth muscles. Our bronchioles is made up of a smooth muscle, our uterine also, and our vascular or our blood vessels are smooth muscles. So kapag ma-activate nato si beta-2 receptor, ang effect ana niya is relaxation of our smooth muscles. And when our bronchioles relax, it means nagadilate na siya. So there will be bronchodilation pag ni-relax. So if this is your bronchioles, pag ni-relax na siya, so pag relax niya ana, the opening will be a lot bigger. So mas daghan ang flow sa air. So bronchodilation. And for our uterus also, for the uterine smooth muscles sa mga babae, it will also cause relaxation. So later, makadiscuss po ta og something to do with pregnant women. Kay, di ba uterus is bahay bata. And then, yeah, for some vascular smooth muscles, it can also relax, so it can cause vasodilation. And then another thing, beta-2 receptors can also be found sa skeletal muscles. So, ang effect ana niya sa skeletal muscle, it will promote potassium uptake, and in turn, mag-cause siya og contraction of our skeletal muscles. So actually, pauna na discussion, ang kanang mga drugs nato for asthma, most of them are beta-2 agonists. So you are very familiar with them, kanang mga salbutamol, formoterol, salmeterol, kanang mga nag-end sa all. Mga beta-2 agonists. So lahi itong ulol ha, lahi po ang all. Mga salbutamol class, they are classified under the beta-2 agonist kasi 'Diba? Remember, para sila sa asthma, and then once you activate this, mag-cause siya og bronchodilation. Nganong gibalikan ako ni siya kasi I will just want to explain why when these asthmatic people um, consume this beta-2 agonist, ang isa ka side effect nila ana is tremor. Magkurog na sila. So this is the reason why. Kasi dili lang beta-2 receptor sa lungs ug sa bronchioles na ang na-activate. Even ang beta-2 receptor sa skeletal muscles pwede i-activate kapag like what do you call that? Kasi ganinang naga-nebulize ka with a salbutamol. So pag humani mo og nebulize, magkurog jud ka. There will be promotion of the potassium uptake. Now, as a pharmacist, if there is someone na asthmatic, mag-ask sa inyo about this, why after inhaling these drugs, magkurog sila, you just tell them that's normal. It's not life-threatening. It's an effect of the drug, though it is considered a side effect, pero it's normal. Ha? Normal lang na siya nga magkurog sila. So, questions? Before ta mag-continue, ang mga asthmatic makarelate nga there will be times na after nebulizing there will really be tremor. Okay? And then in the human liver, we can also see a minimal amount of beta-2 receptor wherein ang effect niya is activation of glycogenolysis. Say meaning ani? Did you discuss this sa inyong biochem? Kaning glycogenolysis? Wala, manawag tabi. Kasing natulog na dira. Familiar. Ano familiar na lang man? How about the others? Majeda. Breakdown of glycogen. Eruption of glycogen. Okay. Sige. Let us have a review about those things. This is supposedly discussed sa inyong biochem. Wait lang. Let me write sa screen. Nakapanta. Ay. Sige. These are the pathways na supposedly discuss ninyo siya sa biochem, no? May makalipong na mga pathways. So, I want to know if you know the difference between these 4 pathways na take place sa atuang body. Lipong. What's a lipong? Anong lipong man? Sabi sa demo. Sige be. When you say class, glycolysis, do not forget this. This is the breakdown of glucose. So remember, our physiological sugar is diba, glucose. That's our number 1 source of energy. But you cannot use glucose as a source of energy if you don't break it down. And the process of breaking it down is called glycolysis. Girap niya tanong sa mukay. Again, glycolysis is the breakdown of glucose. So, ang end product ani class is the pyruvate. So, di ba, katong pathway nga gipa-memorize ni Ma'am Cherry sa inyo, glucose to glucose 1-phosphate, mahimo siya fructose 1 phosphate, ay glucose 6 phosphate, sorry. Glucose 6 phosphate, fructose 6 phosphate, fructose 1,6 biphosphate, and then putulon siya with the aldolase. Anyway, you have to remember that again, glycolysis na. But ang end product ana is the pyruvate. And along the way, you will be using and producing a lot of ATPs. So if si glucose hindi siya ma-convert into ATPs, then you cannot use that as a source of energy. So ang pyruvate, it will be converted into acetyl coenzyme A, and once it becomes acetyl coenzyme A, it will enter the Krebs cycle. And sa Krebs cycle, it will be converted to a lot of chemicals in the body, and along the way, you will be producing ATPs also. Okay, katong pabilog, that's the Krebs cycle. And then, afterwards, some of the chemicals there will be used for the electron transport chain or the ETC. But nonetheless, glycolysis is the breakdown of our glucose for us to have energy. And that is in the form of ATP. Okay? Okay? Questions about glycolysis? By the way, glycolysis takes place in the cytoplasm of the cell. So, cytoplasm of the cell na siya, iyahang end product, again, is the pyruvate. And then pyruvate will become acetyl coenzyme A. It will be transported into the mitochondria. Nganong dalaon man siya sa mitochondria? Kay si Krebs cycle, dito naga-take place sa mitochondria. That is why mitochondria is called the powerhouse of the cell. Kaya nga naman, dinha man ta nagaproduce og daghang ATP. And isa na ditong process na is the Krebs cycle. Okay? And then when you say glycogenesis, so from the term genesis, it means first, it means new, you are making it. So glycogen. So this one naman is building up of glycogen. Okay? So glucose is a monosaccharide. It's a simple sugar, but when you say glycogenesis, that glucose will be converted to glycogen. So glycogen now is a polysaccharide. It's our stored carbohydrate. And where do we store this? It's in the liver, at the same time in our skeletal muscles. Okay? So, nganong kailangan man siya i-store? So, nag-store ta class o glycogen, there will be times na sobra-sobra ang ato ang glucose sa body. Especially if grabe atong kaon, no? Nya ang ato ang, for example lang niha, for example, mikaon kag kanon imong sudan bihon. So carbs plus carbs, daghan kaayo kag carbs. Daghan kay ka og glucose. So the excess glucose will actually undergo glycogenesis. It will be converted into glycogen and then i-store siya sa liver o sa skeletal muscle. Now, when the time comes that you are depleted with glucose, kay for example, hawa kanikaon, after that, after nimo ni kaon og daghan, wa ka ni kaon, so you will be depleted with glucose. I-break down lang pud na ang glycogen, and that is what we call glycogenolysis. So this is breakdown of glycogen. So pag breakdown sa glycogen class, it will still be glucose. So si glucose mag-undergo na po glycolysis, and that's the time we will have energy. So, katong si beta-2 receptor, pag na-activate siya sa human liver, ma-activate ang glycogenolysis, mag-breakdown imuhang glycogen, and then you will have a lot of glucose sa imuhang blood. And then, this time naman, gluconeogenesis. Neo means new. So you are making glucose. Let's simplify na lang the term. So you are making glucose from non-sugar sources. Okay? This is not the opposite. Actually, not really the opposite, but you are making glucose pero asagikan ang glucose nga imuhang ginahimo. Though actually yeah, pwede siya opposite pero ang ato ang source is non-sugar sources. So what do I mean by non-sugar sources? Like you will be making glucose gikan sa imong fats or gikan sa imong proteins. So ano siya, gluconeogenesis ang tawag ana. Questions class? Yeah, baliktad na silang duha, glycolysis and then pabalik is gluconeogenesis. Yeah. It's just that you will start there with the acetyl coenzyme A, and that acetyl coenzyme A comes from the breakdown of either fats and proteins nimo. So before na siya nahimong acetyl coenzyme A again, gika na siya sa fats or gika na siya sa. So paano ni siya class? Pag mukaon ka, syempre, ang glucose i-break down through glycolysis para na kay energy in the form of ATP. Tapos kung sobra imuhang gikaon, your body will do glycogenesis, meaning si glucose monoglycogen is stored sa liver and sa muscles. Now, if the time comes that you will be depleted with glucose, so wala na kay energy, your body will be looking for source of energy and then mao na to ang i-break down. So, i-break down ang glycogen nga na-store and the process is glycogenolysis. But as far as I know, ang na-store nato nga glycogen sa liver will just be good for 12 hours. 12 hours siya class. So kung mosobra 12 hours, wala gihapon ka ni kaon. That's the time ang ato ang body mag-undergo og gluconeogenesis, meaning mangita na siya og other source nato. So, ang himuon kay mag-breakdown na ang fats na ang next niya nga source. So, fats na siya ang iyang himuon i-breakdown ang fats, ma-release si acetyl coenzyme A and then pabaliktad na siya sa mag-form ka og glucose and then the glucose will undergo glycolysis again para naa kay ATP. Okay? So, mao na siya ang process sa pagpayat kanang labi na basta gamay na lang ang imuhang ginakaon, no? So, you cut down your carbs. So, you will be depleted with glucose sa imuhang body. Mauna nga mangita na og other source ato ang body og energy and that will be the fats. I-break down na ang fats sa imuhang lawas. So, mana nga na ay mga diet na mga low carbs na mga diet nga pampapayat. Okay? Questions? Wala. Sige. So, how about the beta-3? So, beta-3 is more concentrated sa ato ang fat cells. Okay? So, kapag ka i-activate pud nimo ning mga beta-3 nato nga receptor sa fat cells, baliktad pud ni siya kay mag-activate siya lipolysis. So when you say lipolysis again, you are breaking down the fats. So though wala siya diri sa ako ang slide class, iingon na lang nako siya daan. Example of an agonist diri sa beta-3 receptor is the I forgot the name. Ang generic name ni Senecal gani? Orlistat. Okay. Are you familiar with this? The Orlistat. So, ang brand name ani na mga common sa market, we have the Senecal, we also have the Lesofat. Yan ang ilang advertisement, tinatago ang taba. Ang mechanism of action ana na drug is nag-bind na siya sa beta-3 receptor, i-activate ang beta-3 receptor, and na-activate ang lipolysis. Okay? Na-activate ang lipolysis. Mo na nga, mamayat daw. Mamayat daw, that this one is a very messy drug. Kasi nakatry mo inom aning Orlistat.
Wala, ma'am.
Wala. This one is a very messy drug. Because this will activate lipolysis, mag-breakdown ang fats. Mugawas man gud ang fats ani. And asa siya mugawas sa imong sa imong anus. So ang mga tao class nga naga inom aning Orlistat, actually ang uban sa ilaha naga napkin, ang uban sa ilaha naga diaper. Kasi bisan og dili ka magbawas, dili ka mag-CR, continuously naga-flow ang oil, ang fats na natunaw, nagagawas siya. So again, this one is a very messy drug. Lood. Okay. Not really that delikado, but it's messy. But kung wala man good ka nag-cut down, though nag-breakdown ng imuhang fats, pero for example, sige gihapon ka og kaon, grabe ang imuhang kaon, wala lay nahitabo sa imuhang pag-inom og Orlistat ana. Mutambok gihapon ka, ang na-breakdown nga fats mailisan lang na siyang bago sa imuhang gikaon. So may pag di na lang ka mo inom, unya mag-diet na lang ka diretso. Kay nagmahal-mahal ra ka. Okay? Well, when this drug was first discovered, ang isa ka capsule ani murag 120 ka pin. So that's the Senecal. Senecal is the innovator drug. And then when their patent expired, mo na siya nga naanay mga bagong brand. Pag ang innovator drug man gud na expire na ilahang patent, pwede na ang uban companies maghimo og sarili nilang brand. Okay? So, muna na siya si Lesofat and other pa na mga brands. I'm not sure with that, Ali. I'm not sure with that. I think it's a new one since I'm not familiar with that anymore. Okay. Yeah, lipase inhibitor. It can also it can, what is that? Prescription drug. Supposedly, they're not in the Philippines. Dili siya in the form of feces, Sarah. It's really the oil na mugawas. What is this? Senecal lipase inhibitor. Oh, okay. OTC siya. I'm not familiar with that. Is that a brand? Let me look at it. Hindi ko familiar basta brands ng istoryahan. But if you will ask me about the generic, most likely I know para asa na siya. Pero pag brand na, generic name. It's an over-the-counter version of Orlistat. Oh, okay. Alay dahil siya pagbasa. Over-the-counter drug. It is an over-the-counter drug because it has a lesser lesser iyahang dose. It's just 60 milligrams. Wherein ang Senecal is 120. So it's just half. Okay. Yeah, ano day siya? Tama, it's an OTC counterpart of Senecal. Okay, karon lang ko kabaluan ng iyahang brand. But anyway, it's a lipase inhibitor also. It will inhibit the enzyme lipase. So, most likely dili pud ka maka-breakdown sa fats nga imuhang gikaon. I'm talking about sa imuhang gikaon ha. Kasi pag mukaon magud tag fatty foods, i-digest man gud na siya sa lipase para ma-absorb siya sa atong body. So since si orlistat can also inhibit the lipase, inhibit niya si lipase, and then the fats nga atong gikaon will remain fats, and then we will just um ano ma-incorporate lang siya diretso sa stool. So wala na siya na-absorb sa body. Pag dili mo na siya ma-absorb, then dili siya ma-store. Okay? Laxatives are not meant to be dapat pang bawas sa weight ha. Kay wala may namayat sa sigig kalibang class. Okay, nagsakit-sakit ra ka sa imong tiyan. That is not effective as pang weight loss. Anyway, ang ako ang suggestion sa inyo ha, kung gusto mo magpapayat, if ever you feel na tambok na kay mo, i-cut down na lang ninyo yung carbs. It's the best thing to do. I-cut down ang carbs.
Ma'am, lisod, ma'am.
Lisod! Yeah, actually lisod. Lisod, di ba I told you last year, not last year, 2019, di ba 2019 I started na dili mo kaon og kanon. So, yeah, nakigbulag ko sa kanon November 22, 2019. I can still remember the date because that's the last time I ate rice. So sa udto sa gabi ato wala na ko ni kaon og rice, and then until now wala mi nagkita sa kanon. Though there are times nga nagkakaon ko og tinapay, that's still carbs. Kaon gyud spaghetti gaina, pero ang kanon nagbulag na mi ana. So from 2019 to 2020, I lost 14 kilos. So that's 2019 to 2020. Yeah, I lost 14 kilos. So, pero kamo kay estudyante man mo class, no, pagkaon mo kanon. Dili siya nindot sa estudyante ani mo kaon og kanon, wala mo energy, your brain needs glucose para mo dagan siya. So puhon na lang pag pharmacist na mo. Kay ako, pharmacist naman ko, unya pila pa kanus pa ko pharmacist 2013 pa. Yeah, 2016 ako nag-decide na makigbulag sa kanon. So, may na lang. Yeah, breakfast depende sa inyo ha. Basta ako I cut down, pero ikaw ay Isabel kapayat ni mo gang. No need to cut down with your rice. My advice Jude is pag estudyante pa ayaw sa mo pakigbulag sa kanon, sa sunod na lang. So next, we have dopamine receptors. We have two types of dopamine receptors class, the D1 and the D2. So the D1 receptor is most likely found sa smooth muscles, mga blood vessels nato, mga blood vessels all over the body, blood vessels na mga splanchnic nato nga blood vessels kanang sa atong gastrointestinal tract na blood vessels, and also blood vessels sa kidneys. So mao na ang number 1 din ha. D1 receptors are most likely, major location is sa kidneys na mga blood vessels. So ang effect ana niya if you activate the dopamine 1 receptor is nagadilate ang blood vessels sa kidneys. And actually that is good for the kidneys if magdilate kasi you will have it will have more efficiency in terms of the flow of the blood pag mo-dilate na siya. So it can facilitate, it can lessen the burden of the kidney when magtrabaho siya. And then D2 naman, the dopamine 2 receptor naman is found just like the alpha 2 receptor. It's found on the nerve endings, and It can also modulate the release of dopamine. Okay, this time it's for dopamine ha. Kasi dopamine receptor man ni siya. So questions class, ang key jud para masabtan ni siya nga chapter is you have to know the receptors, you have to know their location, and when you know their location, you have to understand unsa ang ilahang trabaho dito. And musunod na ang pag-understand ninyo sa effect sa drug and sa ilahang action. Okay? So, na-mention ko na ni Kagaina, it's chronotropic. It's not chrono ha. Chronotropic, it's heart rate. Pag positive, mag-increase ang heart rate. Dromotropic refers to the conduction velocity of the heart or the conduction velocity of the atrioventricular node. It's a part of the heart that nag-accommodate og impulse para mag-beat ang atong heart. We will discuss that one sa chapter sa arrhythmia. Okay? And then, inotropy means force of contraction. Okay? So, humanata sa sa mga receptors and sa ilahang effects. So, we will be talking now about the specific na mga sympathomimetic drugs. So, isa-isahon na nato ang mga drugs. So, be ready kay murag daghan-daghan yun ni sila. So, daghan kay tag drugs, dili jud lalim class ang mag-eskwela o pharmacy. Mo na nga dili jud ta mo sugot na tindera lang ta. Kay kapoy kaayo mag-study ani, diba? Makakutaw sa utok. So, let's start with the most common one. It's the epinephrine. This is our emergency drug. So, other name for epinephrine is adrenaline. Naa siya'y affinity to all receptors, both alpha and beta receptors. Ang effect niya, Jud, is a potent vasoconstrictor at the same time cardiac stimulant. That is why this is considered an emergency drug. Kasi, for example, kanang mga emergency cases sa hospital gani nga pag-check nila sa heart rate murag hinay na gyud kaayo padulong na siya mawala, ginahatagan na nila og epinephrine para ma-stimulate ang pagtrabaho sa heart. And at the same time, pag-check sa BP, baba na kaayo ang BP sa patient. So since this one is a very potent vasoconstrictor, then it can also increase the blood pressure. At the same time, since may trabaho po siya sa renin release, it's on the blood pressure gihapon. So again, emergency drug siya. So you can see this sa hospital. Mao na siya class tapad jud na pirmi ang pharmacy ug ang emergency room. Okay? Kung nakita ninyo ang atoang ang setup sa hospital, duol gyud na ang emergency room ug ang pharmacy. Kung dili sila tapad, at least dili sila ing ato kalayo. Kay nga naman, the emergency drugs should be delivered in the fastest possible time dito sa emergency room. So I can still remember I had my hospital internship when I was a student sa St. Elizabeth. So we are allowed, though sa Davao ko nag-school, pero we were allowed to go back to our hometown to have our internship. So sa St. Elizabeth ko nag-internship, and then dito ko mo makakita na during emergency cases, like for example, nag-heart attack ang patient, niya gidala sa emergency room, and then when the vitals are checked, na baba na kayo ang BP, pawala na ang heartbeat, musinggit na dayon na ang nurse og epinephrine. So musinggit na siya epinephrine. So dapat ang mga pharmacy ana mo appeal og ka ma-appeal sa emergency status sa emergency room, kay managa na dahil ng mga pharmacist ana supplying all the needed drugs and mga gamit dito sa emergency room. Pero there are hospitals na naa sila mga emergency kit. So ang uban nagastock na jud og like epinephrine dito sa emergency room daan. Ang uban kay naadyo tay emergency kit dito sa mga stations. Okay? Sa mga stations, sa mga nurse stations na anay ginatawag og emergency mga emergency kit nila or mga emergency box nila. Anya isa na dito sa sulod kay epinephrine. Pero do naa na siya sa nurse station ang responsible ana kay ang pharmacist. So ang mga hospital pharmacist class nagaadto jud na sila og nurse station, and from time to time gina-check ang mga drugs dito sa emergency box nila. Okay, and then kung magamit siya, for example, na sila gitabang na patient, nagamit ang epinephrine, kailangan na nila i-communicate sa pharmacy nga nagamit nila ang drug so that ma-replenish siya sa pharmacist. Okay? So, though class norepinephrine class ang ato ang major neurotransmitter for this system, pero mas ginagamit nato si epi when it comes to emergency cases because of its affinity to both beta receptor and alpha receptor. Okay, so therapeutic uses, since naa siya, remember, it can bind to beta-2 receptor found in the bronchioles. So it can cause bronchodilation, meaning pwede siya tambal sa bronchospasm. So kanang bronchospasm, isa na siya sa symptoms sa naay asthma o naay COPD. And thus, pwede pod gamiton si epinephrine for anaphylactic shock. That's the severe form of allergy. The person may experience difficulty sa pagginhawa pag nag-anaphylactic shock. And shock means nagababa ang blood pressure. Okay? Pag makabati gani mo, shock, cardiogenic shock, anaphylactic shock, it may be referred to shooting down of the blood pressure. So, since class, si epinephrine can bind to alpha-1 receptor, and then it can cause vasoconstriction and then increase in the blood pressure. So, pwede siya kay anaphylactic shock. And at the same time, na-mention ako kagaina, pwede siya sa beta-1 receptor, beta-2 receptor na mag-cause of bronchodilation to aid the patient na naglisod og ginhawa. And at the same time, since epinephrine can bind to beta-1 receptors found in the heart, so this is an emergency drug for cardiac arrest. So katong akong papa na namatay siya, nag-cardiac arrest akong papa, murag 10 ka ampule sa epinephrine ilahang nagamit. So di ba gidala na mo siya sa hospital and nag-administer sila og epinephrine para mo beat ang iyahang heart, pero wala na jud, bisag 10 na kabuok ang ilahang nagamit. So wala na nakaya sa sa drug mo to nga. After that, kung gitanaw na mo siya sa morgue, ni hupong jud ako ang papa kasi daghan kaayo nga epi ang na inject sa iyahang lawas. Okay? And nganong naay nakabutang diri nga anesthetic. So actually, epinephrine is not an anesthetic. Pero ginagamit siya as an adjunct, an aid, or additional nga drug during pag-administer sa anesthetics. So unsa example ani? For example kanang sa magpaibot bitaw kag ngipon, so ginahatagan na siya og local anesthetic. Local anesthetic lang ang ginagamit pag nagpaibot kag ngipon. Lain po nung paibot kag ngipon, tibuok lawas nimo, gi-anesthesiahan. So local lang. Kung asa lang ang ibuton, dito lang po na siya i-inject. Now, most of the time ang ginagamit sa mga dentist kay lidocaine. So that's the name of the anesthetic, lidocaine. Now, si lidocaine manggod is easily metabolized sa blood. So ang ginahimo sa mga dentist, naga-inject pod sila og epinephrine para mo constrict ang mga blood vessel. So pag mo constrict ang blood vessel ana, mo hinay man ang blood flow. So ang tendency ana, lidocaine will stay sa part kung asa mag-ibot og ngipon and then ma-prolong iyahang action. So dili siya dayon maadto sa blood. So I hope nakuha ninyo ang reason nga nung appeal ang anesthetics din ha sa gamit ni epinephrine. Questions? Isa katambal pa lang to. Mo siya ako ang problema sa pharmacology kay daghan kayo siya. Isa katambal daghan kay tagina storyahan. Wala? Walay pangutana? Sige. So, pag mag-study ka og drug, dili jud mawala ang pag-study sa iyahang adverse effect. Now, since this epinephrine is, ano siya, parehas siyang action ni norepinephrine nga mahimo kang alert, alive, enthusiastic. So, appeal din ha sa iyahang adverse effect ang kanang there will be anxiety, there will be fear, there will be tension pag mudaghan kaayo na siya. Diba, adrenaline rush. So during adrenaline rush, you're actually afraid of the current situation you are in. You have anxiety. It can cause headache and it can cause tremor. Okay? Now, since though ano class ha, it is a drug used for cardiac arrest, but it can also damage the heart. It can cause cardiac arrhythmia. When you say arrhythmia, it's irregular heartbeat. Ganun mahimo mag-irregular imong heartbeat, especially if nag-take ka og digoxin. Digoxin is a drug for heart failure. Parehas manggod sila nga inotropic. When you say, no, parehas sila na chronotropic, na it can increase the heart rate. So, di ba, our normal heart rate is 60 to 100 beats per minute. Again, 60 to 100 beats per minute. But the problem is, pag nihatag kag epinephrine mo, sobra man good siya kasi it will increase. So, pag sobra na, it's called tachycardia. It's one example of an arrhythmia. And then, it can cause pulmonary edema. So, sa lungs niya siya, mag-cause siya na there will be accumulation of water sa lungs. So kanang usahay makabati mo class nga na ay condition nga nagkaroon og tubig sa lungs, we call it pulmonary edema. Okay, kay dili maka flow og tarong ang blood because of the vasoconstriction. So since nag-constrict ang mga blood vessels, mugawas manggod na siya ang tubig and then magstay siya sa lungs. So maglisod og ginhawa atong patient ani pag naay tubig sa lungs. And then tachycardia is on the cardiac arrhythmias. And though it can enhance cardiovascular functions in patients with hyperthyroidism. So katong may problema sa thyroid, too much activity of the thyroid kasi daghan og hormones. So ang problema ana nila karon kay ang ilahang heart. So though ano ni siya, side effect lang niya pero it is kanang beneficial to people with hyperthyroidism. And then it can increase release of stored glucose. So remember class na activation of the receptors nato can also activate glycogenolysis. So ano to siya, to mga gistore na to nga glucose mabalik to sa ato ang blood. So kung ing-ani unya naga-insulin ang patient, kailangan jud itaas ang iyahang dose sa insulin to counteract the effect of epinephrine nga kwaon ang gistore nga glucose ibalik sa blood kay mag-hyperglycemia ang patient ani. Okay? By the way, kanang mga diabetic class nganong dili na sila dapat pagutman. Ang reason ana is mag-shoot up ilahang glucose sa ilahang dugo. Nganuman, pag di man gud ka mukaon, that's the time you will have glycogenolysis and ibalik to tanan sa blood imuhang gistore nga glucose causing hyperglycemia. Okay? Questions about epi? What's the time now? Still have 30 minutes. Okay. Wala pangutana about epi. So let's have norepi. So si norepi, other name of norepinephrine is noradrenaline or levarterinol. Other names na niya. Ang brand name ana in the market is the Levophed. Okay? So just like epinephrine, this is also agonist at both alpha 1 and alpha 2 receptors. But ang effect niya is more on the beta 1 receptor. So dili siya comparable with that with the epinephrine. So mo nang dili na to siya drug of choice for anaphylactic shock. Kaysa anaphylactic shock naga-bronchoconstriction. Pero since mas naga-concentrate man gud ang norepi sa heart, dito iyahang action sa beta 1 receptor. So para asa ang ato ang norepinephrine, this is actually used for cardiogenic shock and septic shock. Okay, so cardiogenic shock is kanang nagahinay ang contraction sa heart. So ato siyang stimulate through stimulating the beta 1 receptor. And then when you say septic shock, kana ganing na ay, when you say sepsis, there is infection sa blood. And pag naamangoy infection sa blood class, it will also cause shock. Mo baba pud ang BP ana, mo baba sad ang contraction sa heart. So you can use norepinephrine for that. The adverse effects are just similar to epinephrine, though we have additional kaning blanching and sloughing of skin along the injected vein. So this one is an injectable. Remember, this is a catecholamines. You cannot give this orally. So dito sa injection site class, pwede siya mag-slough off ang skin, or if it can actually lead to necrosis because of the vasoconstriction. Kasi this is also a potent vasoconstrictor. So pwede mamatay ang tissues surrounding kay wala na blood supply. So kung wala blood supply, wala oxygen. Okay? Questions about norepi? Brand name sa market ha is Levophed. Wala. Natulog na mo? Kasi nabot pa bata sa atong mata pa? Sige. Okay. So, let's move on to the lipong sad. Sige mo ninyo anong nalipong man. Kulang magtulog, class. Tulog magsakto be para fresh ang utok permi tarong ang cognitive function. Dili man sigig pulaw. Daghan ba mo ginabuhat? I'm not really sure ha kasi wala man kung sa akong subject, I don't give a lot of things na himuon. Pero sa basig sa uban, daghan mo ginabuhat. Try to manage your time. Ay mo sigig cellphone kay it can add up to the stress. Pahuwaya po na ninyo inyong mga mata. Okay? Pati ang internet lipong. Okay, let's talk about dopamine. So this is another neurotransmitter which is a precursor para mabuo ato ang norepinephrine. So ang trabaho jud ni dopamine kung sa body ha, it's more on the kidneys. Para siya sa renal function and sa sodium excretion. Pero for the CNS, since this is a neurotransmitter, dopamine is actually important for rewards and satisfaction at the same time addiction. So kanang ma-addict gani ka sa isa ka substance, it has something to do with the action of your dopamine, which is a neurotransmitter. Pero class, kailangan na to i-maintain si dopamine at a normal level in the body because if you have deficiency of dopamine in the ganglia sa imuhang brain, it will lead to Parkinson's disease. So kabalo man noon sa ng Parkinson's disease, no, kanang there will be tremor, there will be muscle rigidity, gahi lahang muscle and then daga kurug-kurug. So unsa nang nakabutang din ha nga levodopa, that is the drug of choice for Parkinson's disease. So 'di ba ang kulang kay dopamine pero it's not actually dopamine nga drug of choice. Levodopa ang drug of choice nato. Kasi dopamine, remember, is easily degraded by enzymes like COMT and MAO. So pag mo administer ka og dopamine from the outside source, murag wala lang siya effect kay gubaon lang gihapon siya. So ang ginahatag nato is levodopa. That's the name of the drug, levodopa. It's an analog of dopamine. It has an advantage na dili siya easily recognized by enzymes like COMT and MAO. And at the same time, it can cross the blood-brain barrier, pakaabot siya sa brain. And pag abot niya sa brain class, actually, levodopa will be converted to dopamine. So, i-convert gihapon siya sa dopamine pag abot sa brain. That's how it treats the Parkinson's disease. But however, pag daghan pud kay kag dopamine sa imuhang brain, it will lead to psychosis. So makabuang sad ang daghan kaayo na dopamine. That is why I told you a while ago nga you have to maintain this at a normal level. Okay? So what are the actions of dopamine sa cardiovascular? CV is cardiovascular system. It can activate the beta receptors of the heart. So dili lang siya purely on the dopamine receptor, it can also bind to beta receptors activating the heart, and at very high doses it can also activate the alpha receptor causing vasoconstriction. Now, ingon ko sa inyo ha, on the dopamine receptors na side, it's more concentrated on the kidneys. So renal and visceral, visceral is on the gastrointestinal tract, so it can dilate both the renal and the splanchnic. That's splanchnic plus splanchnic, that is for the gastrointestinal tract ng mga arteries, resulting to increased blood flow both syempre sa kidneys and sa tuang viscera. So therapeutic uses, take note, though norepinephrine is also used for cardiogenic and septic shock, but it's actually the dopamine which is the drug of choice. So ang iyahang advantage over using norepinephrine is because of its effect sa blood flow sa kidneys. Kasi remember, dopamine receptors, daghan siya sa kidneys, and then it can cause dilation of the blood vessels sa kidneys. Okay, mo na ang iyahang advantage. And then this is used to treat hypotension kasi remember, it can, at high doses, it can also activate alpha receptors causing vasoconstriction. So if there is vasoconstriction, then there is increase in the blood pressure. And at the same time, syempre, because it can also activate the beta receptor, this is also used for heart failure. So I have seen sa St. Elizabeth Hospital dati, there was one lady nga nag-heart attack siya, nag-cardiac arrest siya, gidala siya sa hospital. I was amazed by the doctor on how calm she was. She was very calm. She was directing everyone, every staff, nurses sa emergency room of what to do. So actually, wala man to namatay ang babae. Bisag nag-cardiac arrest siya. Wala siya namatay. The doctor ordered epinephrine. Naghatag to siya epinephrine. The doctor ordered CPR. So nag-CPR, di-CPR pa to ang babae, no? Ang babae to ang nag-cardiac arrest, ang nag-CPR sa iya lalaki. So imagine the force, sakit kay to. And then after that, she ordered also dobutamine and at the same time dopamine. Daghan na kayong nakakabit dito sa babae. So aside sa epinephrine that is used for cardiac arrest, you can also add dopamine and at the same time dobutamine later. I'll be talking about dobutamine also later. So ang ako ang class, ang ako ang slide nga gihatag sa inyo ha, walay ingani. So you may copy this. or you may take a picture of this because I remembered paborito pud nila ipangutana sa board exam. Okay? Yeah, as a doctor, you have to be calm. So, dapat dili ka magpanic if there is an emergency case so that you can think of what to do para ma-save ang imuhang patient. So for me, it was actually commendable na ang doctor ato was very calm when she ano took care of the patient. So again, ang dopamine plus high is a treatment of hypotension. Pwede po siya ihatag for persons with low cardiac output, with poor perfusion of the vital organs, kulang ang blood flow, and used to increase mean arterial pressure in septic shock patients na nag-remain hypotensive after adequate volume expansion. Kanang septic shock, ingon ko kagaina, na ay infection sa blood. So, pwede siya mauwi sa shock, mag-cause siya hypotension sa patient. And then, ang sa septic shock, mag-usahay nag-volume expansion na sila, naghahatag sila plasma expander para mudaghan ang volume sa blood to increase the BP. Pero, for some patients, pag dili jud wala jud effect bisan gipa-expand na ang plasma, ginahatagan sila og dopamine. So natay mga plasma expander sa market ha. I hope you have discussed that one sa pharmacognosy kasi our plasma expanders, most of them na ay gikan sa plant na ay glycoside from Leponostok na steroides sa kanina na ay gikan sa bacteria. So, mo na mga plasma expander ginahatag nato sa patient. So, ang unsa ang paborito sa board exam kaning dose. Kaning dose na ni jud ni siya ang paborito sa board exam kasi ang dopamine lahi-lahi yang activity depende sa dose. So dose dependent yang activity. So at low dose, and ang ginaminan ng low dose, it's 1 to 5 micrograms per kilograms per minute nga intravenous injection. Ang effect ni dopamine is more on the kidneys. So it can increase urine output and it can increase the flow of blood in the kidneys. However, at intermediate or medium dose, that's 5 to 15 micrograms per kilograms per minute IV gihapon, though it can also increase renal blood flow, it can may effect na siya on the heart. So it can increase the cardiac output, the heart rate, and at the same time, the cardiac contractility. So inyong tandaan, low dose is more on the kidneys, intermediate dose is more sa heart. So heart rate, contractility, cardiac output. And then at high dose, it's 20 to 50 micrograms per kilogram per minute. High dose na siya via IV gahapon. It's more on the blood vessels. Kasi this will be the time na dopamine can cause vasoconstriction. So if the patient is hypotensive, this will be beneficial sa iyaha. Although depende sa case sa hypotensive, there are really people na dili siya beneficial when it comes to increase in the blood pressure. So this may increase risk of tachyarrhythmias. Mupaspas noon ang heart rate. And then for some, depende sa case sa patient, pwede siya mag-increase of infusion by 1 to 4 micrograms per kilograms per minute at 10 to 30 minutes interval para ma-achieve nimo ang optimum response. Okay? So, appeal ni siya sa gina-compute sa mga clinical pharmacist. Okay? Wait lang, let me drink water. Galubad na akong tingog. So do not forget class ha sa dosing considerations. This one is the intermediate dose, so beta 1 mo na nga sa heart. And then this is the high dose, so 10 micrograms per kilograms per minute. Mo na nga there is vasoconstriction kasi the effect of dopamine will be on the alpha receptor. And for the low dose, 0.5 to 2, dopaminergic siya mo na nga sa kidneys. Kasi remember, dopamine 1 receptor is most likely found sa kidneys. Okay, that's just a review. Adverse effects similar to epinephrine and norepinephrine. So same effect with that of the stimulation sa sympathetic nervous system. And then we have nausea. There will be hypertension because of the vasoconstriction and arrhythmia na short-lived arrhythmia. Kanang kadali lang ang mukalit og irregular ang heartbeat. Okay? Question so far. So far, nangalipong natatanan. Nalipong na mo sa akong mga ginapangingon. Ako sa dinhi, murag nilubad na akong tingog sa kadaghan sa ako ang giingon. So muna itong original ani nga nga schedule for pharmacognosis, straight 4 hours. Di ko masugot straight 4 hours nga pikol. Mga lipong pangtanan ana. Lipong ko sige yaw-yaw. O wanag yun, mamboto ato ang brain cells ani. Sige, let's talk about isoproterenol. So other name for isoproterenol is isoprenaline. Brand name in the market is Isoprel. Okay? And then na-mention ako when we discussed the structures na because of the presence of a bulky substituent in the amino group, this drug has high affinity to beta receptor. So it's a very potent beta receptor agonist and it has a little effect sa alpha receptors. Now, its effect is actually more on the beta 1, which means ang effect niya is more on the heart. So it's a positive inotropic and chronotropic agent. It can increase the force of contraction of the heart at the same time the rate of contraction. But it can also cause vasodilation. Vasodilation siya. It's more on the beta receptors nga makita pod sa blood vessels. We also have beta receptors on the blood vessels and then ang effect ana niya is vasodilation. Okay? So that's it for actually itong mga drugs, they are our direct acting sympathomimetic drugs nga makabind either sa alpha or sa beta receptors. So diha na nagsugod kay epinephrine hangtod kay isoproterenol. Ang sunod na mga drugs nga atong i-discuss kay mga na ni sila, mga selective. When you say selective, bind lang sila sa alpha 1, ang uban sa alpha 2, and so on. So dito kay isoproterenol, nag-end ang kanang pwede sa alpha 1 ug sa sa alpha ug sa beta receptors. Though later na ako idagdag ng mga mixed acting sympathomimetics. So let's concentrate to alpha 1 agonist. So remember, alpha 1 receptor is, ang major location niya is on the blood vessel and it can cause vasoconstriction leading to the increase in blood pressure. So we have the first drug, we call it midodrine. This is not a common drug in the market. I haven't seen midodrine ever since. Though this is a prodrug, it will be converted into desglimidodrine in the body. It's a selective alpha-1 receptor agonist. Mo na yung mechanism of action. Mo bind siya kay alpha-1 receptor. Ma-activate niya si alpha-1 receptor leading to vasoconstriction and increase in blood pressure. Thus, kanos nato gamiton si midodrine. Since it can cause increase in the blood pressure, then we will give this to persons with hypotension. And to be specific, for orthostatic hypotension. Kaning orthostatic hypotension class, it's a postural hypotension wherein the patient experiences decrease in the blood pressure upon standing Okay? Upon standing ha, so for example, kaning patient, naghigda siya. So, pag higda niya, either taas iyang BP or or normal iyang BP. Pero once ang patient mo tindog, malipong siya, kay ni-shoot down iyang BP. We call it orthostatic hypotension. So, pero actually, that is true for us. Kapag ka naggikan ta naghigda niya mo tindog ta, mubaba man jud ato ang BP class. And that is the result of the gravitational pull. Mubaba jud na ang ato ang blood pressure. So, pero naay mga persons class nga ang atong body magud pag tindog nato, after some time makabawi ra dayon nato ang body, mobalik lang sa normal ato ang BP. Pero ang uban sa ilaha man good kay kanang nahimo nila chronic illness na if they change position or they stand, malipong jud sila. Ang uban kay kanang mawala jud ang consciousness. So mo na siya ang nanginahanglan og care from the doctor, medical treatment. So pwede na to gamiton si midodrine for this. So ang toxicity ani, it will cause supine hypertension. When you say supine, kanang naghigda. Pag maghigda ang patient ani, nagataas ang iyahang BP. And then since this is alpha-1 receptor agonist, so remember alpha-1 receptor can also be found sa pilomotor muscles nato, causing goosebumps. So muna na nakabutang dira piloerection. Okay? Piloerection. That's goosebumps in layman's term. And aside from that, diba, sa urinary bladder, it will increase the closure of the sphincter of the urinary bladder. That is why one toxicity, di makaihi ang patient. There will be urinary retention. No, anemic is different from orthostatic hypotension. So, nganong different man na sila? So, do not, class ha, ayaw ninyo, ayaw mo ka-confuse between anemia and hypotension. It's two different things. Though the patient may suffer the same signs and symptoms, but those two are different. So pag maingon ka og anemia, differentiate na to silang duha. Daghang tag klaseng anemia pero ang pinaka-common is the iron deficiency anemia. Pag kulang kag iron, remember iron is a component of your hemoglobin. So pag kulang kag iron, baba imuhang hemoglobin. And then remember class that hemoglobin is the oxygen carrier. Asa makita si hemoglobin dito sa atong red blood cells. So pag kulang kag hemoglobin, kulang kag oxygen carrier. Ang mga people with anemia, kulang na sila oxygen in the body. Anong kulang og oxygen? Kay kulang og hemoglobin nga naga-carry og oxygen. So, di ba ang purpose jud sa blood, nga maglibot-libot na siya sa body to supply our body with oxygen. So nganong kulang og hemoglobin kay kulang og iron, which is a part of the structure of the heme in hemoglobin. So pag kulang kag oxygen sa body, it's normal nga lipong pug ka. Nakuha kay kulang og oxygen. Muna kong giingon nga the patient may suffer the same signs and symptoms. So ang anemia class has nothing to do with your blood pressure. Ha? Wala na siya, it has nothing to do, wa siya labot sa blood pressure. Kulang jud oxygen imuhang lawas. Pag mingon kag hypotension, mao ni ang baba og BP. So ang BP, normal BP jud is less than 120, less than 80 millimeters of mercury. So take note of the less than, ha? Less than dapat 120 ang systole, this is the systole, and then less than 80 ang diastole. That's the normal BP. Pero pag ang hypotension, tagaan tamog case, example 60/40 na lang imuhang BP, that's the time hypotension na, hypotensive na ka. Mao gyapon na imuhang ma-feel lipong dizziness, there will be dizziness pag baba imuhang BP. So that's true also for anemia, there will be dizziness also, but it's because kulang ka og oxygen. Ha? Pero it has nothing to do with your BP. Nasabtan to? So next time, sa sunod, when someone asks you about anemia and hypotension, that's two different things, ha? Pero ingon ko sa inyo, daghang tagklaseng anemia. Ang pinaka-common lang is the iron deficiency anemia. So this is where we give the iron supplements, the ferrosulfate, and basta mga iron supplements sa market. Daghan mo tagklaseng anemia na apatay, natay aplastic anemia. Isa pa lang type sa anemia na to. We have the megaloblastic anemia. Ayan. And the iron deficiency. Pag aplastic anemia kay, baba ta ng blood cells. When I say blood cells, I'm talking about, wait lang, the RBC, the WBC, and the platelets. Pagka natanan mo na, og we call it aplastic anemia. Si megaloblastic anemia, this is dagko imuhang red blood cells. Very big red blood cells. Magani nga megaloblastic anemia. So, dili siya normal. Kaya pag dako pud kayo imuhang red blood cells, you cannot carry oxygen also. So, kulang gihapon og oxygen imong blood. Mao na nga anemia gihapon siya. So, nganong mudako man ni ang RBC? It's ang kulang ani nimo kay vitamin B12. It's cyanocobalamin. I'm thinking of the other one. What's the other one? It's the vitamin B9. The folic acid. Okay? Pero again, ang pinaka-common sa atong tanan, iron deficiency anemia. Okay? Question so far, class? I really can't finish this. It's 2:51. Okay? Next, we have the phenylephrine. So I believe you are very familiar with this. Phenylephrine is a component of our nasal decongestants. Ang iyahadjong class, yung mechanism of action, it's a direct acting alpha-1 receptor agonist. So this is not a catecholamine kasi remember wala siya isa ka OH. Therefore, dili siya maguba sa COMT. Pwede siya ihatag orally. So aside from being a decongestant, actually phenylephrine is can be used to patients with hypotension. So pag nag-hypotension ang patient, kung walay midodrine, actually we can give phenylephrine. So mga hospitalized and mga surgical patients. So mao na siya ang risk of giving phenylephrine as an over-the-counter drug. Kasi nadyo risk labi na pag mo sabay-sabay na nila mo inom sila Bioflu kay gilagnat daw sila tapos mo inom pa sila Neozep kay na daw sila sip-on, and that is because of the marketing of those brands. Though parehas lang sila og generic names, parehas lang sila og components. It may lead to overdosing sa patient. And the risk there is if the patient is hypertensive na daan. So kung hypertensive na daan ang patient, pagka-problema taani kasi phenylephrine is an agonist to the alpha-1 receptor. Its effect is more on the blood vessels. It can cause vasoconstriction leading to increase in BP. So hinay-hinay ta class sa paghatag sa mga nasal decongestants nato sa mga patients, especially if hypertensive sila daan. Nakuha? Dili pataka og inom. So, please give information also to people para mawala ng risk na. And then, alpha-1 receptor can also be found, di ba, sa mata. na it can cause dilation. So phenylephrine is also an effective mydriatic drug if we want to dilate the pupils, especially if there are surgical operations na needed ang pag-dilate sa pupil. And ang pinaka gamit ni phenylephrine jud is a decongestant. So paano na siya nahimong decongestant? Nga alpha-1 receptor agonist man na siya. Plus, dili siya tambal sa sipon ha. Dili siya tambal sa sipon. It's a decongestant. Pag moingon mo kag tambal sa sipon, ang tinuod, wala jud tay tambal sa sipon. Kasi, sipon is caused by virus. May viral infection na siya. And we have a lot of viruses na nagakos og colds. So that will be impractical if kada virus nga nagakos og cold ato ang himuan og tambal. So wala tay tambal for sipon. But natay mga tambal, symptomatic relief lang ni sila sa sipon. So kung unsa tong mga symptoms sa sipon, mo to'y atong tambalan. And isa sa symptoms sa cold is nasal congestion. Anang binot gud imuhang ilong. So nganong binot man na imuhang ilong? Kasi when you have colds class, it will cause vasodilation. Mag-dilate na imuhang mga blood vessels diri sa imuhang ilong, and once ka mo dilate na siya, the airways will be affected. So pag dilate niya, mugamay ang agianan sa hangin mo nang lisod ka o ginhawa. There will be nasal congestion. So phenylephrine, since it can cause vasoconstriction through the alpha-1 receptor stimulation, pwede jud siya gamiton. Kay pag constrict ana, that's the time ma-relieve ka sa imuhang nasal congestion. Makaagi na ang hangin. So, mara na siyang gamit ni phenylephrine. Pero, when you say tambalan ang cause sa sipon, no, phenylephrine cannot do that. It has nothing to do with the virus. Okay? Questions so far? So far? So far, nangatulog na ta. So far, gikapoy na ta. Laban ra jud din ha ang mga brain cells ha, kay murag daghan-daghan pag yun ni. And then the last one, na direct acting dito sa alpha-1 receptor is the methoxamine. This acts like phenylephrine, pero ang gamit niya is to increase the blood pressure. So this is also used for people with hypotension. Okay? So far na inyong brain. I really want to finish this, but it's already 3 o'clock. It's almost 3 o'clock, so wait lang ha. It's 2:57. So, napakoy 25 slides. I want to finish this today. So we are now sa alpha-2 agonist. So, these are the drugs na specific po sila for alpha-2 agonist only. So what will be the action of this? There are alpha-2 agonists that can be found sa smooth muscles nato and then causing relaxation. So one example of a part sa body nato where we can find the alpha-2 is sa blood vessels. Actually, we can find them sa blood vessels, and kabaliktaran sa alpha-1 ang ilahang action. Kasi alpha-1 can cause vasoconstriction. This time, alpha-2 can cause vasodilation. And if there is vasodilation class, it will result to decrease in the blood pressure. Therefore, these drugs are actually beneficial if the patient is suffering from hypertension. And then aside from that, since this is a presynaptically found receptor, it will also inhibit further release of norepinephrine. So it can decrease the amount of norepinephrine available for binding with other na mga receptors. Okay? So, kung kulang na ang norepinephrine, that also means there will be decrease in the blood pressure since it cannot bind to alpha-1 receptors. So, to summarize, these drugs will be beneficial to people with hypertension. So, the first one is clonidine. I'm not sure if you are familiar with this drug. The brand name in the market available, the innovator drug is the Catapress. Um, it still exists in the market. This is actually common sa market, kaning clonidine. When I say common, commonly found in the pharmacy but not common with ordinary people since most of the time they use either metoprolol or losartan. So what is the clinical application of clonidine? I have mentioned this is used for hypertension since direct siya on the alpha-2 receptor causing vasodilation and it can inhibit further release of norepinephrine. So mag-decrease ang norepinephrine sa ato ang patient. And there is an additional activity of clonidine which is if ibigay siya sa sa people na ganing there's withdrawal symptoms from opiates, tobacco smoking, and benzodiazepine, it can reduce the withdrawal symptoms. When you say withdrawal symptoms, diba, we have like addiction or kanang dependency to these kinds of chemicals or drugs. So, pwede sila maging dependent to opiates. When you say opiates, we have the morphine, the codeine, the likes. And then there is dependence or addiction also to smoking, and then the benzodiazepines also. That is why benzodiazepine is considered a regulated drug. So, pag muundang na sila, labi na basta abrupt ang withdrawal, there will really be withdrawal symptoms. So, some will be having anxiety, ang uban kay there will be tremor, there will be headache. So, since clonidine can decrease further release of norepinephrine, then it can really help a person with withdrawal symptoms from these types of agents. However, adverse effect of clonidine includes dry mouth. Mao na siya ang number one. Kasi remember na kung si acetylcholine or ang cholinergic nga side, ang parasympathetic nervous system is most likely basa. Pag abot diri sa sympathetic nervous system, most likely kay dry. So, mao na siya nga naay dry mouth. And then at the same time, there will be sedation because clonidine acts on the central na alpha-2 receptor. When say central, kanang makit-an sa brain, sa spinal cord, and the likes. So, naa siya effect din to, makakause siya og sedation, lethargy, kanang feeling na kapoy, kanang parehas sa atong feeling karon mga lethargic na ta, murag kapoy. Kapoy kay wala na kusog, gabi na unsa na oras, it's 3:33 niya, kagaina patang 7:30 nagsugod. So, I believe kamo 7:30 yung klase gaina, ako sad 7:30. And then there is constipation. So, kabaliktaran siya sa dumbbells, no? There will be constipation. And ang problem with clonidine, that is why, though this is given for hypertensive patient, it can cause rebound hypertension. So, lisod na siya ang rebound class kay pag pag mubalik ang hypertension, mas grabe pa siya, worse pa siya compared to the previous one. So, ano ang problem with clonidine? So, other drugs that are also considered alpha-2 receptor agonist and ginagamit pod for hypertension are the methyl dopa. The brand name in the market is Aldomet. And then I have mentioned this, I think, sa mga previous na mga lessons nato or even subject that methyl dopa is the drug of choice for women with hypertension. Kasi most of our antihypertensive drugs are teratogenic. When you say teratogenic, they are harmful sa sa bata, sa sulod. So ang methyl dopa is considered safe. So na siya nga drug of choice siya sa babae na buntis with hypertension. And then we have guanfacine and guanabens that are not really common in the Philippines, but I think they do exist sa other countries. Pero sa Philippines, I have not seen these two, but they are also alpha 2 receptor agonist, and ginagamit po sila for hypertension. And then in addition, we have the dexmedetomidine, which is not also common in the Philippines, but alpha 2 receptor agonist gihapon, ginagamit for sedation. It can cause sedation since um, naa siya effect on the neurotransmitters and sa brain. Makaabot siya dito nga part. So ginagamit siya indicated for sedation of initially intubated and mechanically ventilated patients. That's patients class during treatment in an intensive care setting. So kung gusto nato i-sedate ang atuang patient na na-intubate or nag kanang gina-ventilate god gina nag-machine ang nagatabang sa ilaha maginhawa. So we can use this drug. And at the same time, it will help the patient reduce the dose if naga-opioids. So for example, sa cancer patients, since they have severe nga pain, so they will be dependent to opioids or to opiates. And ang problema man gud sa opioids, it can cause respiratory depression, maglisod sila og ginhawa pag masubraan sila ana nga drug. So to reduce the dose, the requirement sa opioids, since sedated ang patient, we can give the dexmedetomidine. And then we have tizanidine, which is also a drug, na naapod siya activity on the alpha 2 receptor, but this one is more of a muscle relaxant kaysa sa mga hypertension na mga treatment. And then we have apraclonidine and brimonidine, brand names na nilang na IR. Ang atuang alpha 2 receptor has an effect in the intraocular pressure. It will facilitate the flow of the aqueous humor. So, mubaba ang intraocular pressure, thus, pwede sila gamiton for glaucoma. Pero, dito sila sa alpha 2 receptor nga naa sa mata. Okay? Kanang alpha 2 receptor nga nasa mata, ang action jud niya is to facilitate the flow of the aqueous humor para dili mo taas ang intraocular pressure. And among the alpha 2 receptors, actually this is the more common one. Once we have the silometazoline, I just don't know if this is common for you, but for me, I always see this manggod. The silometazoline and the oxymetazoline. Ang oxymetazoline jud kay permi gina ka na siya makita. One example of a brand is the Drixin and Vicin LR. So natay Vicin LR sa market. Ginagamit ni sila as topical decongestants because of their ability to promote constriction of the nasal mucosa, and ang Vicin is a treatment for red eyes. Kapag nagapula man gud atong mata, there is vasodilation. Pero man god aniha basig malibog mo, si alpha 2 receptor kapag ka centrally acting siya like sa brain, ang iyahang gina-cause jud kay vasodilation. Mao to nga para sa hypertension si methyl dopa, si clonidine. Pero man gud pag siya peripheral, like local siya or topical, imuha siyang ipahid, ang action jud ni alpha 2 agonist kay vasoconstriction. So kani sila ng mga drugs since topical ni sila like Vicin, ipatulo nimo siya diretso sa mata, and then ang kaning Drixin sa ilong. So mao na nga naga-cause sila vasoconstriction nga kung sa mata it can relieve the vasodilation and mawala ang red eyes, mo na ang Vicin. And then si Drixin naman ginapatulo siya diretso sa ilong. So it can relieve also the vasoconstriction causing the decongestion. So effective po siya nga nasal decongestant. So I hope you can encounter them when you have your internship para mahimong familiar sa ilaha. Now, what is the problem with the two, silometazoline and the oxymetazoline? Dili sila ginagamit for prolonged use. So nakabutang yun na sa ilahang mga label nga pwede lang ninyo nang lang nato sila gamiton as nasal decongestant for up to 3 days. So beyond 3 days, naga-cause naman gud siya og rebound nasal decongestion. So, di ba, na-relieve na ka sa binot nimo sa ilong, mubalik ang binot, and then pag-rebound gani class, it's a severe one. So, it's worse compared to the previous condition. Okay? Questions sa alpha 2 agonist na to? Wala. Wait lang. Okay. Wala. I believe you're familiar with Vicin, right? Ginagamit siya for red eyes.
Dili, ma'am.
You're not familiar with Vicin? Si Aimo jud ang ginagamit sa una. Pero since Aimo has become a knockout drug, recall siya from the market, so you cannot buy Aimo nowadays. So ang nabilin sa market is the oxymetazoline nga Vicin. Okay? Para kana sa mga red eyes and kanang good. Ano si tawagan na? Wala mong ko nakatry. Sore eyes. Kana. Sige, walay question sa alpha-2 agonist. Duha na to ka receptor. We are done with the alpha receptors, both alpha-1 and alpha-2. So let's continue with the beta-1. Beta-1 agonist, found in the heart mostly, but it can also be found sa kidneys. So sa heart plus, do not forget nga positive inotropic, chronotropic sila. Silang tanan. Again, it can cause excitation sa heart, which means there will be positive chronotropy, meaning there will be increase in the heart rate, and positive inotropy, which means there will be increase in the force of contraction. So, some cases, it can cause tachycardia if mulampas sa 100 beats per minute ang heart rate sa patient. So the number one drug which is considered a selective beta-1 agonist is the dobutamine. So na-mention ako siya kagaina because this is one of our emergency drug. You can see this sa pharmacy, not really on the community pharmacy but in the hospital pharmacy. Kasi emergency drug siya. So brand name, isa sa brand name na available is the Dobutrex. It can cause increase in the force of contraction of the heart. So there is positive inotropic effect. And ginagamit siya for both acute heart failure and the cardiogenic shock. So mo-decrease ang blood pressure because of the condition sa heart. So ang problema kay dobutamine, though it can increase the force of the contraction sa heart, it can also affect the heart rate. So there will be ang iyahang isa sa side effect ani or the adverse effect will be arrhythmia. So kung nakita ninyo sa caution, there is an increase in the atrioventricular conduction in patients with atrial fibrillation. So atrial fibrillation class is an example of an arrhythmia. So mo na siya. Dito sa atrium na part. So I don't know if you can still remember your anatomy and physiology of the heart, diba? The heart is divided into atrium and then ventricle. So ang magtachycardia ani nga part is pag moingon kag atrial fibrillation is dito sa atrium na part. And at the same time, another problem with dobutamine is this is kanang at risk of tolerance. So kadugayan og hatag dili na siya mo take og effect sa sa person, sa patient. Okay? And then, dopamine is actually considered a beta-1 agonist, though it is not really selective because it can also bind to dopamine receptors and alpha receptors depende sa dose. But it is considered one as beta-1 receptor agonist, and ang iyahang advantage over the dobutamine is it can protect the kidneys. Kasi remember, it can bind to dopamine receptors and then it can dilate the blood vessels in the kidneys para efficient flow of the blood sa kidneys. So that's all for the beta 1. We only have 2 drugs, dobutamine and dopamine. Questions? Wala. So let's move on sa beta 2 agonist. So remember, beta 2 receptors are found in the bronchioles or the lungs, but it can also be found in the gastrointestinal tract, though bronchioles jud siya. So let's concentrate sa iyahang bronchodilation nga effect, and since it can cause dilation of the bronchioles, this one is very helpful for patients with asthma and COPD. So we have the first drug, and this is the most common one, the albuterol. Actually, it's albuterol in US. They call it albuterol. They don't know salbutamol in the US. Sa ato, we call it salbutamol because the salbutamol has become the generic name here. Pero sa US class, it's actually albuterol. So, kalibog ha, basig na ay mag-pharmacist tuhon sa Amerika, they call it albuterol. So again, but this is salbutamol sa ato ha. So since this is a beta 2 agonist, can dilate the blood, the bronchioles. Thus, ang iyahang gamit jud is for asthma. However, ang toxicity niya, there will be tremor as I've mentioned because beta 2 receptor can also be found sa skeletal muscles causing contraction. So right after taking albuterol or salbutamol, the patient will experience tremor. And then aside from that, there will be cases class na magtachycardia ang patient after salbutamol administration. There will be instances class na si salbutamol makabind kay beta 1 receptor. So pag makabind siya sa beta 1 receptor, remember it's a positive chronotropic na effect. Mo na nga usahay na ay tachycardia. Okay? That's normal also. So other drugs which are considered beta 2 agonist and ginagamit siya for asthma is we have the terbutaline. Let me write the brand name available sa market. We have Bricanil. I don't know if you are familiar with this, but this is Bricanil. And then we have Formoterol and Salmeterol. Let me just add, they are all for asthma ha. Naata ginatawag og SABA and LABA. SABA means short-acting beta 2 agonist. Kaning LABA, long-acting beta 2 agonist. So, sa kalahian nila, this is short-acting and this is used during asthma attack. Okay? So, short-acting man siya kung kadali lang iyahang action pero paspas. So, dali lang siya muak. So, ang SABA class, ginagamit nato siya during the attack. So, relief of the asthma during the attack. So, examples sa SABA, si salbutamol o si terbutaline. Salbutamol and terbutaline. So, mauna, di ba, pag gina-asthma ang patient, during the attack, most of the time, we are using the salbutamol kasi short and fast acting na siya. Hindi lang kayo common si terbutaline, pero natay terbutaline in the market. Now, si long-acting is more on the prevention. Okay? Prevention of the attack. So, you don't use LABA during the attack kay long-acting siya. So, dugay pod ang iyahang action. So, nagdugay ng suffer sa patient, kasi namatay ng patient, wa siya kaginhawa niya, long-acting ato ang gihatag. So, si LABA class, ginahatag nato siya for prevention. Mauni sila ang mga inhalational nato na mga preparations, mga inhaler nga, like for example, gina puff siya once a day, most of the time, either sa gabi para the whole night dili mag-asthma attack. Kay mostly nag-attack ang asthma gabi na siya. So pag kanang ginapapuff ka once a day sa gabi, that's a long-acting na beta-2 agonist for prevention. Protected ka like the whole night. So kani silang duha ang laba. Si formoterol and si salmeterol. Okay? Questions? Ingon sa among teachers on, I cannot forget my pharmacology teacher. Kay nonsense ka. Dili siya jud nonsense ha, pero para lang sa ako ha. Kasi how do you remember kinsa daw sa ilaha ang saba, kinsa ang laba. So ana siya, si salbutamol mo daw sa terbutaline, paspas nimo ginaingon, like when you say salbutamol paspas and terbutaline paspas daw. So short acting siya. And then ang formoterol daw ug ang salmeterol magdugay daw ka mahuman og ingon sa ilahang mga pangalan, so long acting sila. That's how daw you remember. So na-remember gid noon ako siya though during that time nag-ingon yan ni kanang murag feeling nako ha unsa daw, nag-joke ka ma'am, kanang murag ing ana nga feeling, pero na-remember gid din ako siya. So dili na ko siya makalimtan until now. Mga pharmacology teacher na ko na ang nag-ingon na. Anong reason why nag-aatake ang asthma kung gabi? Okay. Actually, we have a separate chapter for asthma ha. So I will discuss there paano nahimo siyang asthma, nganong mo constrict man na ilahang bronchioles. It's a series of events. There will be triggering factors. And one of that is ang bugnaw. So number one, during gabi, pwede siya mag-cause o kanang katong mga series of events nga ako ang giingon leading to asthma. At the same time, pag gabi man good, murag kanang kapoy na gani ang lawas, daghan nahitabo no, daghan nag-exposure ang person sa different kinds of stimulus or stimuli. So matapok-tapok na siya sa gabi. So that's one. Okay? Kalit, mukontra kalit ang muscle, kanang manita ka? That's what you mean? Isabel? Na natulog ka niya, kalit ka, kanang nag-feeling nimo nagdamgo ka, nahulog ka? Is that what you mean with the muscle, with the body jerks? It's actually stress. Yeah, that's stress. That's stress class. If nagayangana gud ka, kanang makalit lang, like kung makalit lang kag panipa, either mata ka or tulog. So most likely sa kanang natulog na kano nga kalit kag panipa, feeling nimo kay kanang nahulog ka or something. Yeah, that's stress. Your body is stressed or tired and your mind is also tired. So that's an indication. Indication na siya. I had that I had that during the internship, manufacturing internship sa Manila kay katong naga-duty pa mi sa Manila sa ano mo ko ato sa Northfield. So sige man kog katulog dito. Kapoy man gud ang duty sa Man of Peace 7 to 7. Di mi magkita sa adlaw. I mean, magkita man mi sa adlaw, pero sa'yo kaayo, like, 7 o'clock. Before 7, dapat na naka sa planta. Tapos pagawas ni mo, wala na yung adlaw, kay 7 o'clock na. So, most likely, dili kayo magkita sa adlaw, no? Tong naga-duty ko sa man of, ingana jud ang duty sa man of class. Though na ay uban planta nga exception, pero sa man of it's 7 to 7 kapoy kisang tanan mo na nga usahay mangita ko og play sa planta kung asa ko matulog. Pero actually, fortunately, wadyo ko nadakpan ato natulog. Kay bawal ba matulog, no? Ginakatawan ko nila kay mukalit manggugog. Mukalit ko gana ba gatulog ko niya sila sige istorya. Niya mukalit ko og panipa ana feeling na ko nahulog na ko. That's sign of kapoy. Unya actually kapoy jud ko ato kay tong nagman of internship me. Ako jud ang pinakauna gamata sa among tanan. We are 10 sa grupo maraming tinapa sa kwarto. Ako ang pinakauna gamata kay ako'y tigluto. So pag mumata na ko, magmata pud ko og isa para maligo na siya. So pag humanyag ligo, magmata siya another one kay para maligo na pud to and so on. And then ako jud ang pinaka last maligo. Kay timing man pag human nilag ligo, human ako gluto. So pag human maligo na ko niya sila nagakaon na. So murag yaya lang ang peg. So ana na siya. Akong role to nagman of internship ni. So murag kapoy. Kapoy dito siya. That's stress. Pag sure mo, oy, murag wala gid baya mo Manila internship nga mahitabo. murag murag the proposal is Davao baya, but I'm not really sure with that. Pero according to Mama Be, ang pinakalayo, Davao. Pero it's okay. Pero wala pa ko sure if kung ako ba or si Ma'am MJ sa inyong kauban. Pero I have no problem kung si Ma'am MJ go, kung ako wala po ko'y problem. So depende na sa mga madam kung kinsa ilahang paubanon dito. Pero okay naman sa Davao. RDL lang, cosmetics lang noon siya class, dili lang siya drug. Ano lang. Medyo dili lang siya. Pag dili man good complete pag cosmetics, like no drug, ay gusto mas nindot jud basta drug no. Kana man magpa-vaccine. Okay lang, daghan naman nagpa-vaccine. Pero okay problem with that. Sakit lang gid siya sa injection site, pero so far sa mga na-injectionan na wala man daw. Daghan akong classmates actually na na-injectionan kasi di ba giuna ang mga frontliners. And then, syempre, mostly sa mga classmates na sa hospital, daghan na sila na bakunahan. Sinovac, ilahang bakuna. Okay naman daw. Nga, napod ko yung pila ka buo classmate nga doktor na karon so naga-duty sila. Nauna jud sila bakuna. So okay raman daw, ang ireklamo lang yun nila kay syempre intramuscular. So sakit jud na siya sa muscle. Okay? Okay. Si Dr. Bisinga nagpa-inject na. Si Dr. Bisinga, kung uyab ni Cherry Joe, pili din sila uyab. Pero sige na lang, ano na lang atong tawag para mas dali. Nagpabakuna na siya. Nakita na ko sa yung post. Uy, di mo na issue, mo man siya nasungog since sa una pag yun, di ba? Para na po spice ang life. Mahapit ta sa love life sa uban. Okay. Nahilom kay pandemic, wala naman nagkita. Hi. Papurnadang love life na apilog ka lockdown. Okay. Let us continue, class. So, remember, class, na ang ato ang beta-2 receptor can also be found sa uterine. So, it can cause relaxation. Mag-relax na just like the bronchioles nga nag-relax, ang uterine smooth muscle mag-relax sad. So, this one is beneficial if there is premature labor contraction. Kanang sa mga buntis gani nga wala pa 9 months ni kalit og contract ng ilahang uterus. So, ma-premature man gud ang baby ana. So para mag-relax, pwede po nato sila gamiton ang beta-2 agonist. So in the form of either terbutaline or ritodrine. So pwede sila for asthma, pero since beta-2 is also nasa uterine smooth muscle na to, pwede sila for this one. Premature labor contraction. So that's it. Ang beta-3 agonist na mention na nako kagaina, and that is the orlistat. So isa ra man pud na siya. Pero actually that is subject to further testing up to now. And they have seen na it can cause liver injury ang kanang orlistat. Pero wala pa gid sila nagpagawas og final judgment about that. So for further study pa na siya. Okay? Yeah. Age sa nanay is one risk factor na siya. Pag mutungtong na gani ka og 35, risky na siya na pregnancy. Okay? So, mao na siya. There is expiration. So, manang magdalita ninyo kay marag. Dili pwede maabtan og 35 kay risky na siya. Stress sa mama also is another one. Manang ma-premature. Ginapadali ko ni Rosel. No, sa siguro nato si Ate MJ, no? Kay marag mag-31 na siya this year. Tingnan ninyo siya na may klase sa iya ugma. Wednesday ugma, no? Sa Thursday. Tingnan ninyo siya. Ay, tomorrow ba na may klase siya? I'm not really sure, ha? Tingnan ninyo siya, magdali siya kay marag mag-31 ata siya this year, no? Marag 2 years man ang among gap. Mag-29 naman ko this year. So, mauna siya. Ay, sabay na. Sabay na lang. Wa man gud mi nagsabot. Good, wa man gud mi kita-kita ni Madam. So, wala. Kana si Cherry, ano lang na siya, idalahig lang na muna siya. Kay bata-bata pa man. Siko. Wala pa din na namatay ng sungog kay Kuya Jay. Napil na biya akong kuya na sa iya. Kay Kuya Jay naman tanan tao. Pati si Ma'am Ero yung tawag sa iya, Kuya Jay. Wala man pag good nagkita, uy, wala uy, napurnada na lockdown na. Pati ang kay Ate MJ. Naunhan namin ni Cherry, bayaran jud ni ani niya, mag-una siya. Gi-record ba yan ni? Makita ganin ni Cherry na mga nga ko. Record. Kasi pagtanaw ninyo itabang mga langit. Ano ni hatag ha, kamo lang ang dapat may access aning ako ang recordings. Kaya nagilibak mo yan na to sila. Commercial break. Ipakata ko i-send na ko Cherry ako kang gilibak sa mga estudyante. So, yan yung Cherry oil. Ngayon ni hatag ha, this is for our own consumption only. Kaya wala ba yan na nakapost ang recording. Ano na siya commercial break, kaya marag usahay, feeling na kuha na ko'y ka-istorya. Basta, diretso ba ako ang gina-discuss diri, di ba ako maningog, ha? Feeling na ko natulog na mo dira. Unya, pag musegway na gani ko, ala, pa mo matingog. That's how I know, nga buhi pa dahil mo diha. So, wala pa dahil mo natulog. Okay, continue na ta. We are done with the specific drugs. Let's talk about the mixed acting sympathomimetics. So their action can either be in the alpha-1 and then the beta-1 receptor. So mix na siya tanan. We have the first one, the ephedrine. Na-mention ako siya sa first part. Though dili siya appeal sa catecholamine sa kay wala na siya OH. So, diri na lang nato siya ibutang sa mixed acting sympatho sympathomimetics. So this one is the first orally active sympathomimetic drug. That is again because of the lacking na OH. So dili na siya catechol. So pwede na siya ihatag orally. Now this one is an alkaloid. So gikan siya sa plant. The name of the plant is mawang. So nimratag. Murag bungi gani nga niingon og bawang, but it's mawang plus ha mawang. Scientific name of that plant is Ephedra sinica. So alkaloid na niya ang ephedrine. So para asa ang ato ang ephedrine? It has the ability to bind sa beta receptor. That is why ang first jud na gamit ni ephedrine is ginagamit jud siya for asthma. Okay? But then, naapod siya activity on the alpha receptor, alpha 1 receptor. So maka-cause pud siya og vasoconstriction. So pwede pud siya gamiton as treatment for hypotension. So si ephedrine class is included dito sa akong ginaingon niya in emergency kit or emergency box nila sa mga stations. So again, pwede siya for asthma because of its ability to bind to the beta-2 receptor, and pwede po siya for hypotension because it can cause vasoconstriction due to its activity to alpha-1 receptor. Now, the problem with ephedrine is it has the ability to reach the central nervous system and cause stimulation of of the CNS. So this one is a regulated drug. Pag ang drug gani na ay activity sa CNS nga either stimulant siya or depressant siya, regulated drug na siya. Okay? And then we have another one, the pseudoephedrine. That's the real name, pseudoephedrine. The brand name is Sudafed. But this is not available in the Philippines class. Take note. It is prohibited in the Philippines. But to some other countries like sa India, I have seen ang ilahang Advil dito. Diba Advil na to, ibuprofen. Naa sila'y Advil OD. Ang pangalan Advil OD ang brand. Tapos ang iyahang generic name kay pseudoephedrine. So ginagamit ni nila nga decongestant. So just like how we use the phenylephrine. So it can cause vasoconstriction again because of its action sa alpha-1 receptor. So this is the reason kaning third dinhi nga information is the reason why this is not available in the Philippines. So this is because this is a precursor, a raw material when we want to make shabu. So pag mahimo kag shabu, methamphetamine, you can use pseudoephedrine as a raw material. Okay? Bawal dyan na siya diri sa Pilipinas. And then the third one, we have the phenylpropanolamine. So I believe this is also common to us. This is different from phenylephrine. Alam na this, but you cannot purchase pseudoephedrine diri sa Philippines. By the way, ang pangalan class sa laboratory nga nagabuhat og shabu is clandestine laboratory. Again, it's called clandestine laboratory. So bawal magtukod og clandestine laboratory diri sa Pilipinas. Kaya pag maingon kag clandestine laboratory, himuanan na siya og shabu. So ginaraid na siya sa PIDEA nya basig an underground laboratory is called clandestine laboratory. So bawal na siya diri no, basig makabalita na lang ko pharmacist na dakpan dito sa clandestine laboratory. So again, you cannot buy pseudoephedrine here. Okay. Acetone is another one. Acetone is also a raw material in making shabu. That is why you cannot actually purchase acetone in large amount class. You can purchase a little amount, 10 ml, pero actually you cannot buy a pure acetone nowadays in the market. So muna ginailisan na nila ron ng pangalan, nail polish remover, and it's a diluted one. Kay acetone is a precursor also of making shabu. Ito mag-storya ano. Kanang shabu be kay dili dapat na magbuhat ana. Kasi baligya sa kalitro nga sinton. Napasig na sila permit. So, kabalo na magbuhat og cocaine sa muka. I don't know with KCC ha, if they were able to ano, magbenta sila og isa ka litro nga acetone, maybe they have the permit from PDEA. If you want to sell those things, kailangan na permit sa PDEA. Okay? Asa na ta? Phenylpropanolamine na tano. So this is different from phenylephrine because phenylephrine is a specific alpha-1 receptor agonist. Kani this is a mixed acting one. Though parehas sila og gamit class, this is a nasal decongestant. At the same time class, phenylpropanolamine by the way is an appetite suppressant. So if sige ka og take ani nga drug, di ka ganahan og kaon. But the problem is to some other countries, this is already banned because of the high incidence of hemorrhagic stroke. Kasi remember, it can cause vasoconstriction and then especially in women, taas ang case ani sa babae nga hemorrhagic stroke. So, ilahan na ning gi-withdraw from the market. But it's still used in the Philippines maybe because walay naga-study, wala tay supporting na mga studies or documents na daghan diri nag-hemorrhagic stroke because of this. So wala muna nga wala siya na ban sa Philippines. Okay? But to other countries na remove na siya sa market. I don't know, phenylpropanolamine should actually be a prescription drug, but it has become an OTC here in the Philippines. So that's what you call only in the Philippines. So I think we are living up to our, what do you call that, slogan, na only in the Philippines. Yeah, ano siya, lie, kanang only in the Philippines. Mo na siya. We're really living up to our slogan, no? Diba, na siya dati sa tourism sa Philippines, na only in the Philippines, diba? Kita na yun. Wala mong nag-study, nga naga-cause jud ba siya hemorrhagic stroke diri sa ato. So wala ta kabalo nga ang uban na stroke na di ay kay napataka lang di ay inom og phenylpropanolamine. Man gyud nag-take note. Ikapi sa one countries na ang slogan. Ha? Wala kasabot. Bala sila, basta we are living up to our slogan nga only in the Philippines. Okay, so take note class, if the patient has hypertension tapos gisipon siya na siya nasal congestion, ya mangita siya sa pharmacy unsa iyahang pwede i-take. Ang pwede ra gyud ninyo i-recommend steam inhalation. Wala tay tambal for nasal congestion na pwede para sa hypertensive na patient. So, ingna siya magpausok na lang siya. Tangig asin para maluag ang iyahang airways. Again, we call it steam inhalation. Moro dyan ay tambal. Wala na'y lain. Okay? So, that's it for the mixed acting sympathomimetics. Now, let's talk. This will just be fast. Indirect acting sympathomimetics. So, do not forget ha, pag ang tambal gani gitawag og indirect acting, it has nothing to do with the receptor. So, just like our indirect acting na mga cholinergic agonist, nga wala sila ilabot kay muscarinic o kay nicotinic receptors, kaya ang ilahang action dito sa cholinesterase na enzyme, ingani pod ang indirect acting sympathomimetics. They will not bind to either alpha or beta receptor. So, iba ilahang mechanism of action. So, na-mention na ako ni sa previous na slide na they have two mechanisms of action. The first one is they may enter the sympathetic nerve ending and ipagawas, i-displace, i-release ang stored catecholamine transmitter. So they are called displacers or mga amphetamine-like sila. Kaya mo niya siyang action ni amphetamine. Musulod sila dito sa neuron and ipagawas nila ang mga na-store nga norepi or dopa dito. Okay? Or other drugs nga indirect acting can be an inhibitor sa NET, norepinephrine transporter. Or katong pag-reuptake bitaw na nagawas ng norepinephrine, di ba, ibalik siya supposedly sa sulod. And then, kanina mga drug, i-inhibit si NET para norepinephrine will stay outside and pwede siya makabind sa receptor. So, agonist gihapon sila in the sense nga na-activate man gihapon ang receptor kay there is norepinephrine nga na-displace, na ay norepinephrine nga nagstay sa gawas and makabind sa receptor. Though, wa sila gihimo dito sa receptor mismo. Okay? So, mo ni sila ang mga amphetamine-like. Pag amphetamine-like, gani, mo ni ang mga displacer. So, syempre, si amphetamine, na-mention na nako nga, this is a drug for, this is a drug for ADHD. So, this is a CNS stimulant. It can affect the mood and alertness of a person, especially pag depressed. And it can also affect the appetite. Actually, this is an appetite suppressant. So, ang amphetamine, since na-displace man si norepinephrine, so it can stimulate both alpha and beta receptors. So, nagyapon siya vasoconstricting na effect and mag-increase sad ang heart rate. So, again, asa siya ginagamit? This is a drug for attention deficit hyperactivity disorder in children. So, ang reseta ani ang psychiatrist syempre. So, kailangan i-diagnose sa. Dili pwede ka paliton kay kapamilya sila ni methamphetamine. So, mga prohibited drugs sila. So, this is very similar to amphetamine, ang methamphetamine. However, it has higher ratio of central to peripheral action. So, labi na sa central, maugad yun mong utok aning shabu. And then, we have another amphetamine-like na drug. We call it phenmetrazine, which is a family of phenylisopropylamine. And actually, this is a drug of abuse, pero gina-market ni siya dati as anorexant. Pag ginatawagan ni ang drug nga anorexant class, ano na siya, appetite suppressant na siya. Okay? Appetite suppressant. Kaya di ba pag mag-anorexia ka, kamukaon. So that is an eating disorder. Na di kamukaon kaya di ka gusto manambok. So pag anorexia ang tambal para mawala imuhang appetite. And then we have the methylphenidate. This is a board exam question. Anong board exam question na siya? Because this is our drug of choice for children with ADHD. Though si amphetamine ginagamit, diba, for ADHD, but our drug of choice here is the methylphenidate. Pero kapamilya yapon sila sa amphetamine, ha. So this can also be abused, pero effective siya for children with ADHD. And then we have here the modafinil. Amphetamine-like ang iyahang action, pero in terms of its structure, its neurochemical profile, and behavioral effects, different sila ni amphetamine. So, naa siya'y other na mechanisms of action. So, it can inhibit both norepinephrine and dopamine transporters. Pagbalik. And increase interstitial concentrations of norepinephrine. So most likely na siya action on the norepinephrine transporter, but aside from the norepinephrine, it can also affect the dopamine, the serotonin, and the glutamate. Kani silang tulo mga neurotransmitters pud ni sila. Though glutamate plus is an amino acid, but it can also act as a neurotransmitter. And then at the same time, by the way, kaning dopamine, serotonin, and glutamate, mga ano ni sila, mga excitatory neurotransmitter. Pag daghan kag norepinephrine, dopamine, serotonin, o glutamate, you are excited, you are alert. And at the same time, gina-decrease niya ang GABA. So that's gamma aminobutyric acid. That's another neurotransmitter, but it differs from the 4 because GABA is an inhibitory neurotransmitter. So pag ginatawag na siya inhibitory neurotransmitter, it means baliktad, dili siya maka-excite, maka-depress siya og function sa cell. Pero si modafinil, ibaba niya ang GABA. So pang pa-excite jud ni si modafinil. That is why ginahatag siya to improve wakefulness sa mga narcoleptic. Anong people with narcolepsy. Are you familiar with narcolepsy, class? Anyone here who knows what narcolepsy is?
Ano ba itong sleeping na sickness, ma'am?
Yeah. Pag moingon ka, wait lang, tubago lang sa mama, be. Okay. Pag moingon kag narcolepsy class, it's a condition nga mo kalit lang og katulog. Okay, like for example, nag-istorya ta karon tas nikalit lang og katulog, that's narcolepsy. So, since ang modafinil is for alertness, dopamine, norepinephrine, serotonin, so para dili siya magsigig, katulog. Being narcoleptic is very dangerous, especially like if you are driving, you are handling heavy equipment, kana. Kay mukalit jud na sila katulog, class. Okay? Yeah. Like for example, na sila ginabuhat, mukalit sila og katulog. Maski nagakao, nagaunsa pa na sila dira, mukalit sila katulog. That's narcolepsy. Okay? So that's a condition. May problem ta kung sige katulog. Kung si Mama Eroy pa na, di mo sige practice ka matay. Ang sige daw katulog, kay sige practice ka matay. Pero dili na siya yung anahang kanang magsige katulog. Ang ilaha jud kay bisan pag in the middle of something sila, mukalit sila katulog. So they have something in their brain. May problem sila sa brain. Ana. Okay? And then we have tyramine, though I have mentioned this. This is from our foods, especially if the food is stored for a longer period of time. Si Cherry yun nasa gawas, wait lang. So again, if it is stored for a longer period of time, it is fermented, daghan na siya og tyramine. So muna example din ha kay ang cheese. So it can also displace catecholamine stored in the vesicle and managhan ng norepinephrine, so it can cause increase in the BP, and then especially if sabay pag yun mo siya sa MAO inhibitor, mag hypertensive crisis jud ang person. Okay? So that is for the amphetamine like katong displacers nato, i-displace ang stored catecholamines. So we have the second one, mo ni ang second group kay second mechanism of action, catecholamine reuptake inhibitors, katong nag-inhibit kay NET, norepinephrine transporter. So daghanon gihapon ang ang amount sa norepinephrine sa synaptic cleft kay wala man siya nabalik sa sulod. Remember, 90% of the released norepinephrine will be taken back inside through the NET. So we have the first one, atomoxetine, just like methylphenidate and amphetamine. This can be used for ADHD in children. The same thing with the reboxetine, pareha silang action ni atomoxetine. No, dili siya common class sa atua. Kay pila raman ang hatag jud og drug for children with ADHD. Ang uban diri nga na ADHD sa ato mild raman, so madala lang siya og therapy. No, wala kaayo sila ginahatagan o drug. So, dili siya common. And then, na-mention ako ni last time, the sibutramine. This is an FDA-approved drug for long-term treatment sa obesity. Okay? Kasi, amphetamine analog siya, it can suppress appetite also. Kapag you have a lot of norepinephrine in your body, you're very alert, you're very excited to the point na, wala ka ginabati og gutom. So, manang appetite suppressant siya. This is the FDA-approved one for long-term treatment sa obesity. Pero again, you cannot purchase this over the counter. You have to be properly diagnosed nga obese jud ka before katagaan ani. And then we have the cocaine. This is a local anesthetic. Cocaine class, by the way, is also an alkaloid. So gikan po siya sa plant. Pero originally used as a local anesthetic. However, na siya effect on the norepinephrine transporter. That is why this is also subject for abuse. It can increase the norepinephrine in the synaptic cleft, leading to alertness also. So, muna ilahang abuse si cocaine. Okay? So, unsa ang iyang psychological effect? Shorter lasting but more intense than amphetamine. So that's all for the indirect acting sympathomimetic drugs. And then I'll just have a short discussion. We're down sa 2 slides na lang. We have the dopamine agonist. Kasi dopamine is our precursor before siya nahimong norepinephrine. And then we have available dopamine receptors in the body, especially in the kidneys. So I have mentioned this kagaina, the levodopa. This is the drug of choice for Parkinson's disease. We cannot use dopamine directly to person with Parkinson's because dopamine is a catecholamine. It can be degraded by COMT in the gut, so it cannot be taken orally. Thus, we use the levodopa na dili siya ma-recognize by the enzymes, but it can cross the blood-brain barrier and then inside the brain, it can be converted to dopamine. Thus, it can be used as a treatment for Parkinson's disease. Do not forget that the problem with Parkinson's disease is low levels of dopamine in the brain. And then the last one, we have the phenoldopam. So from the name itself, dopam, so it has something to do with dopamine. This is a D1 receptor agonist. Remember, D1 is most likely found sa blood vessels nato, pwede sa kidneys also. So it can cause vasodilation. Vasodilation jud ni iyahang activity pag dopamine 1 receptor. Thus, kung naay vasodilation, mag-decrease ang BP. So, si phenoldopam is used for severe hypertension, but this is given intravenous. So, we don't give this as a maintenance drug for hypertension. It can be used for severe hypertension. It's given intravenously to dilate the blood vessels and decrease the blood pressure. So, hangak ang chapter 6. Questions, class? About the chapter 6? Lipaw. Again, this is activity number 6. This is Avogadro's constant or Avogadro's number. When you say Avogadro's number, class, it's the number of particles present sa isa ka mole na substance. Pag mayroon kag mole, that is the unit for the amount of substance. So sa isa ka mole, ang Avogadro's ang number of particles or number of particles na present sa isa ka mole. So, kanang Avogadro's number, it's a constant. So, that is 6.0221 times 10 raised to the power of 23 particles per mole. So, ang iyahang reference ani is actually the carbon. Ang 12 grams na carbon na ay 6.0221 times 10 raised to the power of 23 particles. So, it was coined by Amadeo Avogadro in 1811. So, ginagamit ni siya to calculate the number of atoms or number of molecules sa isa ka gram na substance. So, either compound or element. So, we have the formula. Number of atoms times moles of an element divided by mole of Avogadro's number of an element equals moles of an element. So again, number of atoms. Actually, we can know the number of atoms, no? That is very small. i-multiply lang nato siya sa Avogadro's number. So, ang Avogadro's number class, kanang isa ka mole sa element, constant na siya. Naadyan na siya 6.0221 times 10 raised to the power of 23 particles. And then we will know pila ka moles ang isa ka element. Okay? So, just like this example, how many moles of silver are in 6.01 times 10 raised to the power of 23 atoms of silver. So kung nado kay 6.01 times 10 raised to the power of 23 atoms of silver, pila na siya ka moles? So you will just use the formula, number of atoms, so this is it, 6.01 times 10 raised to the power of 23. I-multiply lang nimo na siya diretso sa Avogadro's number. So sa Avogadro's number, sa isa ka mole na akay 6.022 times 10 raised to the power of 23 atoms. So makancel ang atoms. Multiply lang nimo 6.01 times 10 raised to the power of 23 times 1 mole divided by 6.022 times 10. By the way, this should be na 1. Ayan. Let me recheck it. So 6.01 times 10 raised to the power of 23 divided by 6.0221 times 10 raised to the power of 23. So the answer here is 0.998 moles of silver. So kung ingana kadaghan ang atoms, it is just 0.998 moles. Kasi ang atuang sa ano jud sa pag-analyze og quantity sa matter, di ba? We always either use the grams or the moles. Okay? And then, so what is the mass in grams? This one naman is another example of a problem. This time, if given ang atoms, we can also determine kung pila ka grams pudto siya nga substance. So dugtungan lang nato na siya class ang atuang formula. So mo lang na siya gihapon actually number of atoms times the Avogadro's number sa isa ka mole sa element, pero dugangan nato og molar mass. So molar mass of an element over moles of an element, you will get the grams of an element. So wait lang, ilista na kami siya. 64. Dugay. Mag-abot, Jessa. Manghulam na lang ka, Jessa. Okay, Kaila. Sa Dame. Daghan na sila sa Dame. Mostly sa daghan og libro katong mga estudyante nako sa Dame. Gapalit jud sila libro. Sige. So, example, you have what is the mass in grams of 1.20 times 10 raised to the power of 8 atoms of copper. So, yung anak kadaghan nga atom sa copper, pila daw na siya ka grams. So, i-multiply lang nimo na siya class, 1.20 times 10 raised to the power of 8 atoms of copper. I-multiply nato siya sa isa ka mole sa copper na ana siya ay Avogadro's number, 6.022. Kalimtan dyan ng 1. 6.0221 times 10 raised to the power of 23 copper. That's atoms of copper. Kajot. This is atoms of copper. And then, ang next, di ba, is multiply nimo siya sa molar mass. This time, it's just the atomic weight kay copper naman ang gihatag. So, atomic weight na siya ni copper, and then to be uniform class, we will round off the atomic weights to the nearest whole number. So that's 64. So, di ba, 64 grams per mole, mo na siya nga 64 grams tapos mole sa baba. So, makancel ang atoms, makancel ang mole, ang mabilin ana grams. So, 1.20 times raised to the power times 20 times 10 raised to the power of 8 times 1 times 64, and then divided by 6.0221 times 10 raised to the power of 23. Yan. So the answer is 1. This is 1.28. 1.28 times 10 raised to the power of negative 14 grams of copper. So, anaon lang nato siya pag solve. So, sa inyuhang activity, this will just be sample computation sa Avogadro's constant. You have there, want this handwritten ha, kasi you have to show your solution. Box your final answer, round off your final answer to 2 decimal places, but you have to use the whole number na atomic weight. So the first part is you have to convert the number of atoms to the number of moles. And then on the second part, given gihapon ang number of atoms, pero you have to convert it into grams. So lima-lima lang na siya. That will be your activity this afternoon. So it's still 4:42. You still have more than an hour left. So I hope you will start para dili siya matambak.